the meeting.
I've started live stream. I'll just let you know when it's confirmed to be on YouTube.
Thank you. I've just been informed that our meeting has now gone live. So good afternoon, everyone. Welcome to the joint meeting of the Scrutiny Committees. I would like to start by welcoming those members of the public and press who are watching the live stream of this meeting through the Council's YouTube page. Due to government guidance on social distancing, this meeting is taking place remotely in accordance with current legislation as laid out in the local authorities and police and crime panels, coronavirus, flexibility of local authority and police and crime panel meetings, England and Wales, regulations 2020, which make provision for remote attendance at and remote access to council meetings. The meeting is also following the Peterborough City Council's virtual meeting protocol. In order for this meeting to run smoothly, I ask several things from members and participants. Firstly, that you keep your video camera switched on if possible at all times, with your microphone muted except when you're invited to speak. The Democratic Services team who are supporting this meeting will be monitoring the participants list to see if anyone has dropped out of the meeting and will try and contact you to provide assistance to rejoin the meeting should this happen. As with all new systems, we may run into technical problems, and for this I ask for your patience. Should this occur, an adjournment of the meeting will be declared while the fault is addressed, and the public broadcast will be paused. If it is not possible, the meeting will be adjourned until such a time it can be reconvened. Finally, I would like to remind members and participants that all virtual meetings are recorded. Before we move on to the first item on the agenda, I will begin by calling the names of all Scrutiny Committee members to establish that you are present. When I call out your name, please unmute your microphone and confirm that you are in attendance. Thank you. So I'll run through the list of members in alphabetical order, and if you could unmute your microphone and just let everybody know that you're here. So, Councillor Aiken.
Present.
Councillor Ali.
Present.
Councillor Barkham.
Present.
Councillor Bisby.
Present.
Councillor Sandra Bond.
Present.
Councillor Brown.
Present.
Councillor Burbidge.
Present.
Councillor Casey.
Present.
Councillor Day.
Present.
Councillor Dowson.
Present.
Councillor Ellis.
Present.
Councillor Iqbal.
Present.
Councillor John Fox.
Present.
Councillor Judy Fox. Councillor Judy Fox.
She's having a bit of problems with the laptop, so.
Okay, I'll come back to Councillor Judy Fox then. Councillor Goodwin.
Present.
Councillor Harper.
Yes, present.
Councillor Haynes.
Present.
Councillor Howard.
Present.
Councillor Howell,
Present.
Councillor Jones,
Present.
Councillor Lane, Councillor Over,
Present.
Councillor Kyan,
Present.
Councillor Robinson,
Present.
Councillor Rush,
Present.
Councillor Simons,
Present.
Councillor Skibstead,
Present.
Councillor Warren,
Present.
Councillor Wiggin,
Present.
Councillor Yazeen.
Present.
I'd also like to introduce the cooperative members of the committee. If you'd like to confirm your presence, Al Kingsley,
Present.
Rizwan Rahmatullah,
Present.
Parish Councillor Susie Lucas,
Present.
Parish Councillor Neil Boyce,
Present.
Parish Councillor Keith Leavesley,
Present.
Parish Councillor June Bull,
Present.
Parish Councillor Junaid Batty,
Present.
and the following education co-optees: Peter Cantley,
Present.
Flavio Vitesse,
Present.
Claire Watchorn.
Present.
Thank you. And I'll go back to Councillor Judy Fox. Could you confirm your presence, please?
Thank you, Paulina. I had trouble with the internet. It keeps going off. So obviously I lost you when you called my name out. Do apologise, but I'm here.
You're
Thank you.
present and correct. All right. Thank you very much. So thank you. I will now move on to the first item on the agenda, which is the appointment of the chairman or chairwoman for the joint meeting of the scrutiny committees, which is in accordance with Part 4, Section 8, Scrutiny Committee Procedure Rule, Section 13, Joint Meetings of Scrutiny Committees, which states that the chairman will be appointed from among the chairmen or chairwomen of the committees who are holding the meeting. The chairman and chairwomen present tonight are Councillor Harper, Councillor Goodwin, Councillor Simons and Councillor Aiken. I would like to propose that for consistency at these important meetings, the chairman or chairwoman appointed at tonight's meeting will also take the position of chairman at any future meetings of the Joint Scrutiny Committee that are held specifically to scrutinise Peterborough City Council's response to COVID-19. Could I ask if anyone disagrees with this proposal? If you disagree with the proposal, could you raise your virtual blue hand, please? So I can see that some hands have been raised. So Councillor Simons.
Yeah, sorry, I come in a bit early. I'd just like to propose Councillor Harper.
Ah, okay. And then I have, just to check for clarity though, I have Councillor Ellis also who's raised his hand. Did you want to speak, Councillor Ellis?
Yes, I just think that it really should be decided by the councillors at each meeting because, for example, we don't know who's always going to be attending and there could be different reasons at different meetings. We don't know how long we're going to have to be doing this for. So I think it should be decided at each individual's joint scrutiny meeting, and that is my proposal.
Okay, so we've had the proposal that it's decided at each meeting. Are there any objections to that proposal? Would you like to continue in the normal format where we propose and appoint a chairman at each meeting, regardless of what the meeting is about? Councillor Bisby, I noticed you've got your hand up, and Councillor Lane. So Councillor Bisby?
I'd like it to go as you initially said, please.
Councillor Lane?
Yes, same as Councillor Bisby, please.
I'm sorry, Councillor Lane, I couldn't hear that too well. Councillor Over, I noticed you've got your hand up.
Yes, thank you. I would support the initial and would second Councillor Chris's nomination.
Okay, so but we have a second recommendation. So Councillor Ellis, as we haven't got a total agreement on either, would you like to provide a seconder for your nomination, please? Is there a seconder for Councillor Ellis's nomination? If you'd like to raise your hand. I think I can see.
Paulina, can I come in, please?
Yes.
I'm not sure that Councillor Ellis was making another nomination. I think what he was saying was that he didn't agree with the proposal that one chairman should chair all the COVID scrutiny meetings. So I think the question is there anybody else that would be opposed to that proposal apart from Councillor Ellis? Could anyone raise their hand, please?
I can't see anybody else raising their hand to the original suggestion, so it looks like
Paulina.
Sorry, Councillor Dowson. I have seen Councillor Dowson. Sorry, Councillor Ellis. I beg your pardon.
So just to clarify, it is just my proposal is just that we continue as we have done in joint scrutinies before, that the chair is elected at the beginning of each meeting. That is my only proposal. I think, correct me if I'm wrong, I think Councillor Dowson is seconding, but I may be wrong.
Paulina, I think you might need to take a vote then on this.
Yeah.
Is it?
Okay, so the proposal is that we continue in the normal format where we select a chairman for the joint meeting of the scrutiny committees at each meeting. Councillor Ellis has put the proposal forward and he's advising that Councillor Dowson is seconding that. Councillor Dowson, would you like to confirm you are seconding that proposal?
Yes.
I think
yes.
Paulina, I think because there's some opposition to it, we will need a formal proposer and seconder for the proposal that you made at the beginning as well, that we can keep the same chair.
Okay, so we'll take the original proposal first, and the original proposal is that we appoint the appointed chairman for this meeting for consistency remains chairman for any future meetings that will deal with the Peterborough Council's response to COVID-19. All of the joint scrutiny meetings will be individually appointed chairman. So I'll read through the list of committee members, and if you could advise me one at a time if you're for or against that proposal or abstaining. And if you could unmute your microphone and let me know. So first, so this is for the original proposal, which is to appoint the chairman tonight and for future meetings of this kind. Councillor Aiken.
For.
Councillor Ali.
Against.
Councillor Barkham.
For.
Councillor Bisby.
For.
Councillor Bond, Sandra Bond.
For.
Councillor Brown.
For.
Councillor Burbidge.
For.
Councillor Casey.
For.
Councillor Day.
For.
Councillor Dowson.
Against.
Thank you. Councillor John Fox.
For.
Councillor Amjad Iqbal.
Against.
Councillor Judy Fox.
For.
Councillor Goodwin.
For.
Councillor Harper.
I think in my case, I'll abstain because my name's been mentioned. Thank you.
Councillor Haynes.
4.
Councillor Hemraj. Sorry, beg your pardon, Councillor Hemraj is not here. Councillor Howard.
4.
Councillor Howell.
4.
Councillor Jones.
4.
Councillor Lane.
4.
Councillor Over.
4.
Councillor Kime.
Against.
Councillor Robinson.
Against.
Councillor Rush.
4.
Councillor Simons.
4.
Councillor Skibstead.
Against.
Councillor Warren.
4.
Councillor Wiggin.
4.
Sorry, was that 4, Councillor Wiggin?
4. Yes.
Councillor Yazeen.
Against.
Okay, thank you, members. So I'll just count that up.
Paulina, you've missed me.
Sorry, who's that speaking?
Ellis.
I'm sorry. I can't. Oh, Councillor Ellis. I do beg your pardon. Councillor Ellis.
Against.
Against.
Thank you.
Thank you. I do apologise for that. So, so I have 21 in favour of that recommendation. I have 7 against and 1 abstention. So the original recommendation stands. Okay.
Pauline, I think it was 8 against, just for your record.
8 against, right.
Yeah, okay.
Thank you. So thank you very much, members. So with that in mind then, we will move on to the item on the agenda, which appoints the chairman. So please could I have any nominations for the appointment of chairman? Councillor Bisby, would you like to speak?
It's already been said, but I propose Councillor Chris Harper.
Thank you. And do I have a seconder for that? Councillor Aiken?
I second Chris Harper becoming chair.
Thank you. And do I have any further nominations? If I do, could you please raise your virtual hand? No, I can't see any further nominations. So as there are no further nominations, can I ask if any members of the committee object to the nomination of Councillor Harper by raising their function hand, a blue hand now? No, thank you very much. Right. So as there's no formal objection, could Councillor Harper please take position of chairman for this meeting and any future meetings of this committee that may take place to consider Peterborough City Council's response to COVID-19. Welcome, Councillor Harper, if you would like to take your role as chairman now. Thank you very much.
Thank you very much, Paulina, and thank you very much, everybody. Okay, welcome to the joint meeting of the scrutiny committees, and thank you for appointing me as chairman to this committee. This meeting is an opportunity for all members of each scrutiny committee to come together to scrutinise Peterborough City Council's response to the COVID-19 pandemic. You will have received an email with the link to the agenda and papers for this meeting, which provides you with a covering report and links to access the individual service highlight reports and the financial report, which was presented to Cabinet on the 11th of May 2020. These are the reports that we will be scrutinising today. To help with the smooth running of the meeting, I would introduce each service area separately so that the relevant officer may answer any questions. Questions and discussion will take place on one service area at a time, and once finished, we will move on to the next service area. Please ensure that your microphone is set to mute at all times unless you're invited to speak. Please ensure your video camera remains on at all times, and if you wish to speak, then please raise the virtual hand, which is the blue hand, and located at the bottom of your participants section. I and the Democratic Services team will keep an eye on the participants list to see who wishes to speak. Please be patient if you are not invited straight away and you have raised your hand, as there may be other people willing to speak before you. Officers in attendance today are as follows: Gillian Beasley, Chief Executive of Peterborough City Council; Charlotte Black, Service Director, Adults and Safeguarding; Will Patton, Service Director, Commissioning; Lou Williams, Service Director, Children and Safeguarding; Jonathan Lewis, Service Director, Education; Adrian Chapman, Service Director for Communities and Partnerships; Dr. Liz Robin, Director of Public Health; Steve Cox, Executive Director, Place and Economy; Mohammed Hussain, Director, Housing Needs and Supply; Graham Hughes, Service Director, Highways and Transport; Sue Grace, Director, Customers and Digital Services; Amanda Askham, Director of Business Improvement and Development; Peter Carpenter, Acting Corporate Director, Resources; Fiona McMillan, Director of Law and Governance. The leader, Councillor Holditch, and all of the Cabinet members are also in attendance. Before we move on to agenda item 2, I would like to ask, if you would, for a minute's silence in memory of our dear colleague and fellow councillor and member of the Scrutiny, Councillor Louise Coles, who sadly recently passed away. It was her funeral today, and under normal circumstances, I know many of us would have been in attendance to pay our respects. So I ask now that we do this in her memory for 1 minute silence. Thank you. Thank you very much. We'll move on now to agenda item 2, apologies for absence. Paulina, have there been any apologies received?
Thank you, Chairman. I have received apologies from Councillor Jamil, and Councillor Amjad Iqbal will be in attendance as his substitute, and also from Councillor Hemraj. I've also had a notification that Councillor Sanford will be in attendance at the meeting, but he will be a little late. Thank you. I will let you know when he's arrived. Thank you.
Thank you, Paulina. We'll then move on to agenda item 3, declarations of interest and whipping declarations. Do any members of the committee have any declarations of interest or whipping declarations? No, don't see any. Thank you very much. Move then to agenda item 4, which is public questions. We will now move to public questions. Paulina, if any questions have been received from the public, could you let us know, please?
Thank you, Chairman. No, we haven't received any questions from members of the public. Thank you.
Okay, thank you very much. We'll now move then to agenda item 5, Peterborough City Council's response to COVID-19. Please can I remind members that when asking questions, that your questions refer to the service area being discussed at the time. Thank you. The first area we will look at is Peterborough City Council's response to COVID-19 cover report, an overall response and Civil Contingencies Act 2014. Gillian Beasley, the Chief Executive, will you speak on this item and take any questions? Would you speak on this item and take any questions? Would you like to introduce the report or go straight to those questions?
So thank you, Chairman, and I will do some introductory remarks to the report. And good afternoon, everybody. It's good to see so many of you. It seems such a long time since we've been together, but it's still nevertheless great to see so many of you here today to talk about such an important topic. And as you know, this is your first report to the Joint Scrutiny Committee on the Council's response to COVID-19 pandemic. And I did want to start by setting out the context and, if you like, the legislative framework within which we have been working, the Council has been working, and how that framework is set out so that you understand the decision making, if you like, within that framework. And it really starts with the Civil Contingencies Act 2004, and that sets out a broad framework under which local areas and the national government come together to respond and prepare for emergencies. And this emergency is defined as one that threatens serious damage to human welfare. And under that act, we're required to set up what is called a local resilience forum. That brings together a number of organisations to prepare, plan and respond and also recover from an emergency. And that local resilience forum also provides an interface with government. And you will probably remember that on some of the government briefings, which we tend to have about 5 o'clock in the afternoon, government ministers often talk about their work with local resilience forums. Well, our local resilience forum has to take, is based on the police force areas. So it's one that covers Cambridgeshire and Peterborough. And those local resilience forums are made up of what we call category 1 and category 2 responders. And for those of you that don't know, category 1 responders are local authorities, health services, blue light services, and in this case, public health. And category 2 responders, they're not necessarily at the core of the response, but they also are very important. And in this case, some of our utility companies, Red Cross, voluntary organisation, prison and probation services are example of those category 2 responders. And so what actually happens is local resilience forums have a duty in law to plan for emergencies, ensure that business continuity plans are in place and establish communications with the public on civil protection matters. So the plan that we're currently operating under is what we call the Pandemic Influenza Plan. This was stood up, as we now say, in March of this year. And this plan also envisages the setting up of what is called a strategic coordinating group. And all that is category 1 and category 2 responders coming together to plan, prepare and respond to this emergency. Currently, I co-chair the strategic coordinating group with Jan Thomas, who is from our CCG. So it's a health and local authority led arrangement. What also happens with strategic commissioning groups is they stand up other groups to respond to this emergency. And I have set out in the report you have before you some of those groups, which are set out in paragraph 4.9. So basically between the strategic commissioning group, there is next a tactical group, and that group is really does a lot of the operational work. And then there are some subgroups that sit below that. And you won't be surprised in an emergency like this to know that one of the subgroups is on PPE. We have a community facing subgroup, excess death subgroup, a communication group, and more recently, and this is very topical at the moment, we've set up a track and trace group. And you will know that in the media, a lot is being said about the responsibility at a local level that local authorities and other organisations have for the track and trace work that the government is currently developing, particularly on the Isle of Wight as we speak. So that's, if you like, the overarching framework. But within our own council, within Peterborough City Council, we also have what we call command and control arrangements, and they're led by the joint management team, which I lead, and that group meets every day. We meet at 8 o'clock in the morning, and the pattern of working goes something like this. We've received a lot of guidance, a lot of direction from the government that comes into the SCG, but it also comes into local authorities. It comes in during the day, overnight, at weekends. We're tasked with reading that, understanding it, and then at 8 o'clock meetings in the morning, we task out what needs to be done. And if there's anything that is getting in our way, if you like, we then escalate that into the strategic commissioning group if that can be resolved by the wider partnership of category 1 and category 2 responders. And we've been working like that from really the beginning of March, every day, to make sure that we cover every aspect of the response that we've required to make. So we look at actions that we need to take, we look at the risks within this emergency, and we also look very carefully at finances. And I suspect today you will have a look carefully at some of the financial arrangements that we've got in place. So I think what you can see in relation to this, working under the Civil Contingencies Act, there is a very, very clearly defined and regimented response, what we call a command and control response, which the SCG and us as a council have to report day in, day out to government on that response. Now, one of the things that's often asked of me is what is the councillor role within such arrangements? And government has issued guidance on that. And it was published recently, although there was some previous guidance, and it's on emergency response structures for COVID-19. And it sets out that council's involvement in SCGs will be through their senior officer representation, and those senior officers have executive authority to take decisions. And then it quotes, because SCGs are based upon input from those tasked with exercising their trained professional judgment in directing an organisation's operational response to an emergency. And so that gives you the context as to why today it's officers presenting to you, because operationally, under the Civil Contingencies Act, we are charged with the responsibility to respond to all the issues in relation to the COVID-19 emergency. Now, the guidance also, and this is something which I'm sure will resonate with you, talks about and reflects on the fact that the pandemic emergency response has been stood up for much, much longer than most emergencies. So when we're trained as officers on emergency reactions and emergency planning, we usually look at floods or fires, and if you know, they would last between 3 to 5 days at the most. There would be an immediate emergency response and then followed after that by recovery. Well, of course, in this case, the emergency has gone on for some time. And the guidance says, and it's quite right to say this, that the SCGs and the senior officers like myself make arrangements to link in councillors to make sure that the political dimension of this emergency is properly handled. So we had a discussion about how we did that in Peterborough City Council some time ago. We discussed that with group leaders, and we agreed on a range of measures by which we as senior officers and the SCG would account directly through to councillors. So the first way that we've done that is through the weekly highlight reports, where, if you like, the detailed activity in each of the subject areas that you're going to have a look at today is reported to you each week. And you'll see the current activity in the reports that were published on Monday, that they're detailed. And those reports are in the public domain. So the transparency of this is evident so that the public can also see what is going on week in, week out. The SCG also does 1 to 2 weekly updates, which you get. And up until last week, there were also daily media reports that came to you, although we've gone down to 2 weekly reports now. And also group leaders meet fortnightly, where we go through in detail the service areas, our finances, and also we've been talking more recently about recovery. And we have already gone to Cabinet with similar reports a couple of weeks ago, which you are seeing today. So a quite comprehensive and detailed report into councillors of the activity. I also wanted to reflect on what I've said before about this issue about response versus recovery. I would say probably the last 2 weeks, 3 weeks, for officers like myself, but officers across all levels of the council, the response activity has been more intense probably than we've seen. And so it's fair to say we are still in response mode, but at the same time, we've started to effect some of our recovery activity. So if I can give you some examples, and we will exemplify this through the reports that directors will give you. So we're still responding in relation to schools, getting vulnerable children into schools. Care homes is high on the agenda, and you saw the government announcements last week on the infection control money going to care homes. The shielded group, our numbers are going up, and we are responsible for supporting people in that group. We have our own Peterborough hub, which is supporting vulnerable people. and we're still responding in relation to rough sleepers. Those are just some examples and many more of the response that we're still giving to this emergency. In the recovery area, you will know that there's a lot of discussion about opening schools from the 1st of June, and that depends on obviously tracking how the virus is. We're talking about safer cycling, we're talking about reopening the city centre, and as I've described, we've recently set up in the SCG the track and trace work, which is designed to aid the country unlocking from the COVID-19 emergency. So for councils and for those who work in the community, we're not only recovering or starting to recover, we're also still responding. And that creates a huge amount, an intense amount of work that your officers and yourselves, because it's not just officers, are involved in. And in relation to the role of Scrutiny Committee, and we've discussed the issue about scrutinise what we're doing, the the Centre for Public Scrutiny offers some insights into that. And I think this is very important to us as officers. It says basically that we are there responding, but we need to take into account what's happening on the ground. And the best place to understand and learn that is from the intelligence we get from the community and from councillors, feeding in, offering insights as to how the response that we're making is being received on the ground. So your insights today to us, it's not just about scrutiny, are vital to us. That will shape our response going forward. And we have had huge amounts of feedback from councillors and from the community, which has helped shape our response. We've had Cabinet already helping enormously in that regard in relation to their meeting. And I want to say, just last but not least, because I think this is important, I want to say thank you to you all, because I know how hard councillors have been working. I know how hard communities have been working, our faith group, voluntary organisations. There's been some amazing kindness, amazing practical help, amazing resources that have been put in, and the support that has been given has been absolutely exemplary and has absolutely made the response that we're doing day in and day out work on the ground. So thank you for that. And I hope that overview of how this works in practice is helpful to today's scrutiny, Chairman, and I'll finish there and take any questions. Thank you.
Thank you very much, Gillian. Committee, do you have any questions, please, for Gillian Beasley? I have Councillor Bisby first, if you'd like to unmute.
Thank you. Rather than a question, I'd like to thank Gillian and all the team that have been doing all this work. I have been aware of the work that's been going on, not both just locally, but nationally and regionally as well. The team have been working very long hours, and I think we should thank them for the work that they've done on behalf of us and the community. So thank you.
Thank you, Councillor Bisby. Councillor Howell.
Thank you, and I would echo Councillor Bisby's comments, absolutely. Gillian, I know that we're going to hear from Steve Cox a little bit later. However, I just want to say, as you referenced the pandemic influenza plan, everything's been fantastic, but it feels like we were caught out a little bit regarding rough sleepers initially, and where we could house them when the government instructed that they could no longer be housed within the accommodation that we had them in because of the need to self-distance. Is that something you're able to feed back into the plan so that we're not caught out again should anything like this happen in the future?
So I think we got, as in many cases, the guidance on the, I can't remember which exact day, and then it was as we have to work out what that means, and then we have to task out. So we responded quickly, and to be honest, nobody could, I think, have known the scale and extent of the response that we needed to make. And I think we stood up accommodation as quickly as we possibly could. We've made some changes to that. We've learnt a lot as well. And I think that's one of the things I would want to say to you all, that the response that we've made, we will reflect on as we go forward. And one hopes that this never happens to us again. But we will do a proper feedback and reflection exercise. So I appreciate your comments, Councillor Howe. Thank you.
Thank you, Councillor Howe. Councillor Sanford, please. And welcome.
All the senior officers of the council and all the partner organisations for the tremendous amount of hard work that has gone in responding to the COVID emergency. We've picked up on a bit of that through the group leaders meetings that we've been having, but we've only been peripherally involved in it. In her remarks, Gillian actually mentioned about the recovery plan, and she mentioned one of the things she mentioned was safer cycling. This is something that Grant Shapps, as Transport Secretary, has emphasised, that what the government wants to see is far more people cycling into work, and what's happened during the COVID emergency, and that there's already been a massive upsurge in cycling. Could Gillian, or perhaps one of the directors, actually give us an indication as to what Peterborough is planning? Because the article that appeared in the Peterborough Telegraph listed a whole range of initiatives in Cambridge, but there wasn't anything mentioned about Peterborough. So will we be wanting to capitalise on this upsurge in cycling?
Thank you, Gillian. Would you like to answer?
Yeah, Chairman, I'm happy to say that, and what I'm going to suggest to Councillor Sanford is, yes, we are on the ball with this. Steve Cox will be covering this when it gets to his part of the meeting, Councillor Sanford. So we'll pick it up then, because it is an important part of the response that we're making, and also the recovery. So I'll leave it to Steve to give you the detail, if that's okay.
Thank you.
Thank you very much, Gillian. Councillor Jones.
Yeah, thanks, Chair. I echo the sentiments of Ray Bisby, and thinking about Councillor Howell, what she's been saying is, have we been able to look at any neighbouring authorities? The danger is we look at the micro environment. Are we having a look round at any neighbouring authorities? Have we had chance to do that, or are we just comparing and contrasting with the national picture to see if there's any tricks we're missing, or any best practice we could bring into what Cambridgeshire and Peterborough are doing?
So thank you for that question, Councillor Jones. And I think it's fair to say that the networking in relation to COVID-19 has been extensive, both at a national level, which you mentioned, but also at a regional level. So we're part of a network in the east of England. And it's been a really important thing to share and network, so that we don't reinvent the wheel. Somebody solves something on something, they share it. The generosity, I think, of that has been amazing. So we're quite forward on the track and trace, and we're seen as the regional leader on that at the moment. But we would gain help from something else that somebody's cracked. So that has happened in spadefuls, and it's had to happen because we've never faced anything like this before. And nobody is jealous about their creativity and their thinking. They've shared it, and they've shared it in a really helpful way. So, you know, I think I've just come from a national call today, and that was very helpful. Sue Grace has done some regional calls. I'm on other networks. So that has been a really, I think, important feature of how we've been able to respond well, by learning from each other, learning from our mistakes as well, fixing those, and then moving on. So that is very much in place.
Okay, I don't have any further questions, any hands up for questions. Thank you, Gillian. Thank you for your answers. Okay, we'll move on to the next service area, and that is adult social care and commissioning. Charlotte Black and Will Patton will speak to this item and take any questions. Charlotte or Will, would one of you like to provide an update to the report, or would you like to go straight to questions?
Certainly, Chair, I'm very happy to give a brief introduction, and then perhaps the best thing would be if Will follows on, and then I suspect we'll answer your questions between us. So very briefly, I mean, the highlight report sets out that adult social care is very much in response mode at the moment still. That's both in terms of providing practical support to care homes, and also anticipating and trying to make sure that any needs in the community are dealt with really quickly as the lockdown is reduced and relaxed. We're also making sure that anyone who was discharged from hospital has a plan and a way forward, and a social care assessment and a financial assessment has been completed, and we're well underway with that process. And then also we've contacted all the Community Hub, Adrian's team has worked with us to contact all the carers we've got on our books and ask if they need any support, because obviously in many cases family carers are carrying quite a lot of strain at the moment, especially in the lockdown situation. So we're really focusing on those people in the community that we think if we can give them a bit of extra help, they'll be able to continue to maintain their independence and tap into the local community support networks that have been so fantastic in this process.
Thank you very much, Charlotte. Is Will coming in now?
Yeah, if I may, thank you, Chair. So from a commissioning perspective, we've had three priorities as we move into the second phase. One is to maintain our residential care capacity, to protect our domiciliary care capacity, and maintain flow and care and market sustainability. We talk about in the report, we've commissioned significantly more beds through block contracts. We've increased fees by 10% to the end of June. We're providing PPE to providers when they're at the risk of running out, which is free of charge. And we're providing quite significant advice and guidance to providers through weekly forums and newsletters. We've been asked, the latest guidance has asked us to pull together a resilience plan for providers, which is what we're working with at the moment with our providers. So we're collaborating with them on that for the longer term. And that includes the distribution of the £600 million announcement that was recently announced for care homes to support their infection control. So if I stop there,
okay.
I'm happy to take any questions.
Okay, thank you, Will. Thank you, Charlotte. We'll go to questions. Councillor Graham, I've got you first, please.
Thank you very much, Chair. First of all, I'd like to begin by thanking everybody in the Council on behalf of our group of councillors for all the hard work that they've undertaken during this time in unprecedented circumstances, and also to reiterate our thoughts with Councillor Louise Coles' family on today. I'd like to move to my question, please. My question is, in regards to the uplift of funding that has taken place and allocated to care homes, has Peterborough City Council developed a strategy on how they're going to be allocating that funding? Is this being directed to council-funded residents only, or is it being spread across the spectrum to be inclusive of spending on those residents who are also self-funding? And do the care homes have any autonomy in making decisions on how they are allocated that funding and how they wish to spend it? Would you like to elaborate on that, please? Thank you.
Okay, Charlotte or Will, which one of you is going to answer that one?
Yeah, I'm happy to. So I'm happy to answer that. So as far as the 10% is concerned, that was to all of our contracted providers. The 600 million that's recently been announced is for all providers, whether we contract with them or not. As far as self-funders are concerned, when we discharged people from the acute, which was under phase 1, we discharged those into care homes, and regardless of whether they were a self-funder or not. In other words, those fees were picked up as part of the NHSE funding. And then in terms of, were there any terms around 10%? No, there wasn't. So we had a lot of feedback from providers through the forums around their costs that they were seeing as a result of COVID, which included things like PPE, transport, staff costs, and so the 10% was awarded to help assist them with those costs as they see fit.
Okay, thank you. Councillor Kwan, do you have a second question at all on that?
Yes, I do. Thank you very much, Chair. What's the turnover time been for delivery of PPE to the providers within the area, seeing that we've seen publicly that there have been quite a few donations from organisations delivering PPE to care homes. So what's the turnover time between requesting PPE and delivery of that, please? Thank you.
So perhaps I can answer that. So we've had a very strong focus on PPE and making sure that all our providers have PPE and our own staff do. Our social care providers are responsible for accessing their own PPE, but we have an arrangement where the LRF has a specific hub which all our providers can go to if they need emergency supplies, and they can ask for that and get it, if not the same day, the next day. And that arrangement is still in place if any of our providers have difficulties.
Thank you very much, Charlotte. Councillor Goodwin then, please.
Right. Chris, I just wanted to make the point that I believe in Peterborough, the last numbers that I saw, that we've only had 12 deaths in Peterborough in care homes with care providers. And I know even 12 is more than we want to have, but recognising how many people have in care have died throughout the country, I think that our care providers in the Peterborough area have worked extremely hard to keep our elderly or older people safe. And I also wanted to thank the officers, because I know that they've done a lot of work around working with the care providers to provide PPE and to give them the support that they needed when they had deaths, and really needed that you know, that support from Peterborough City Council officers. Thank you.
Thank you very much. Okay, well, we'll move straight to Councillor Aitken then, please.
Thank you, Chair. Will and Charlotte, reading the report, it mentioned how patients were being moved out of hospital as quickly as possible and back into the community. Obviously, I'm thinking about the carers and the fact that they were probably already stretched before everything happened. Can you just give me some feedback on how the community are coping, how the carers, the companies, the organisations and the carers themselves are coping in general with the additional workload that they've got?
I think, so there's obviously, there's family carers. So in Peterborough, 248 people were discharged from hospital. And of those, 25% went into a residential placement. But the rest of those people went home. So that means they went home with either domiciliary care arrangement or someone in their home looking after them, or the family looking after them. I think it's a difficult question to answer in very general terms, because we have, as I said, we've phoned all the family carers, and some are coping really well and some are saying they're starting to find it quite difficult. I think the main issue for the paid carers has been that many of the things that you've heard about in the media in terms of access to PPE, making sure that they can get tests and test results quickly. And obviously for many of them, they've also had to juggle family responsibilities as well, with children at home and that sort of thing. So I think it's been a very demanding time, but I think you know, I agree with the comments that members have made. I think our social care providers have done a fantastic job, and we rely on them so much, and we've relied on them especially in this process, and we've made absolutely sure that if they do need support from us in any way, then we get alongside them. And sometimes that's in very practical terms, you know, our arrangement staff actually directly getting involved in some of that work in residential homes, and also picking up any care that where domiciliary care providers can't meet those needs. But generally, most of the challenge and the demand has really been in the residential and homes in particular.
Councillor Aitken, do you have a supplementary?
Sorry, yes. Will, were you going to say something there? Sorry.
Yes, sorry if I may. I would just add that the providers and the staff working for the providers have been absolutely remarkable. Their response to this and the way they've gone about supporting us and people of Peterborough has been absolutely amazing, actually. So I think we just need to be really clear about that under sometimes very difficult circumstances. So without them, we would be in a very different place, I have to say.
Chair, if I could say one last thing.
Yes.
I mean, obviously, I reiterate what everybody else has said, but what I would like to say is I'd like to congratulate both IT and Democratic Services for at least setting up this meeting. It's absolutely amazing that we've got over 60 people on this video conferencing call being able to communicate and carry on sort of the work that councillors need to do. So just like to thank them all.
Thank you very much. I'm sure that's echoed across all of us. Thank you very much, Councillor Aitken. Okay, I have no further questions. So I'm going to move on to item 9 on my list, which is the next service area we will look at is Children's Services. Lou Williams will speak to this item and take any questions. Lou, would you like to provide an update to the report, or would you like to go straight to questions?
I'll provide a brief update, I think. I mean, I think the first thing to say for children's services is that really so you've just been hearing from adults, and adults are clearly in the middle of, you know, the challenges resulting from COVID, and have had to deal with real demands, increased demands in requests for services and so on. I think for children's, our peak in demand will start when the schools start to go back to usual. And in actual fact, because most referrals about children for children's services come from schools and from nurseries and from early years settings, because so few children are in school at the moment, our referrals have gone down quite a bit. So we're doing lots of work to make sure that we're keeping our vulnerable children safe. But what we do expect is that we will get an increase in referrals as schools start to go back to normal, which probably really in reality will be in September, because I think much of schools will start before then. The big bulk of pupils are unlikely to go back to school now until September. I think also I'd just like to say that in some of my earlier highlight reports, I expressed some worries that the understandable pressure on NHS services to make way for what they were then expecting at the beginning of this journey, a peak of adults with significant COVID health related difficulties, that there was a big pressure on NH services to kind of empty wards, to reduce services and all the rest of it. And actually I was quite concerned, as were a lot of people, about whether there would be an impact for children in that. As you know, hospitals were saying that children should avoid coming into acute hospital for treatment, either in relation to childhood diseases, but also in relation to mental health. I have to say that actually those fears haven't really come to fruition. NHS has done an incredible job managing and supporting services across the piece, and has continued to support children more or less as they would have done, except as with our services, we are, you know, we've had to restrict face-to-face visiting, and so we're only doing face-to-face visiting to children who are most vulnerable. The other thing I think it's really important to say is just to acknowledge the work of our schools in supporting vulnerable children. So whilst we haven't had large numbers of children, vulnerable children, going into school, and that's the same in across the country, the percentages of vulnerable children going to school are relatively low in Peterborough, though better actually than most areas. Schools have been fantastic in maintaining contact with children that they know are vulnerable, as have our own staff. And I think finally, I'd just like to say that, you know, it has been really challenging. Our staff have been amazing, as other people have said about their staff, but we've also had some real positives as well, actually. So, you know, we've learned that families, some types of family and some types of need are better addressed by virtual drop-ins than face-to-face services. And actually, perhaps not so much of a surprise, but our youth services are finding they get a better quality of engagement virtually with some young people than they do when they go around and see them face-to-face. So there are things that we would definitely want to keep as well. So children's services basically, you know, have reacted and responded really well. Our peak is probably yet to come.
Okay, thank you, Lou. I've got questions already lined up. Councillor Bisby, please.
Thank you. I'm glad to hear that you're learning stuff, and I'm hoping that new learning will go forward. I think what we have to do is remember that we will be heading forward to a new normal, and what we need to do is take the good learning we've got now forward. But I just want to ask about the care leavers, because where they are in a position of maybe not having the family support that many other people may have, how have we been supporting them, please?
So you're quite right to highlight care leavers, Councillor Bisby. They're clearly a vulnerable group. They already tend to you know, feel socially isolated. So through this process are more likely to feel more socially isolated, if you like. We've done, I mean, our personal advisors teams are doing an amazing job in terms of supporting care leavers. So a combination of face-to-face visiting, but also lots of virtual contact. And actually, for the most part, our care leavers are okay. In the early days, when there were, big pressures on shopping, one of the things that happens with care leavers very often is they don't get out of bed particularly early in the morning. So by the time they were getting to the supermarket, there wasn't anything left, so there were some real practical things that we had to help them with. So we were delivering food parcels, and we've had donations from various organisations for both Peterborough and Cambridgeshire actually to help us with that, as well as using obviously our own funds. So that's been really good. And we are in the process of making sure that all of our care leavers have got laptops that are 4G enabled as well. That was using DFE funding, as well as, again, a charitable donation recently. So it's been a really positive picture actually of people coming forward to support care leavers, and we make sure that care leavers, as with all of our vulnerable children, have got opportunities to do virtual drop-ins and so on. And again, actually, some of those have been really well used, and it's something that we'd want to continue post this crisis.
Councillor Bisby, you have a supplementary on that?
Yes, it's we're supplying laptops. I'm just wondering, some of these people haven't got laptops, will not have the internet. So are we helping to supply the internet for them as well?
Yes, they come with a dongle to connect with the data allowance. Most of our care leavers do have laptops already. This is just to make sure that all of them have access to those services.
Very good, thank you. Councillor Robinson, please.
Thank you, good evening. So my question is about this likely peak in demand for child protection services. I noticed in your report on the 15th of May, you'd commented that we might require additional temporary staff for front door and assessment purposes. Now, we're already on a bit of a recruitment push for social workers. So I just wondered, is this doable, and when is a firm decision being made about such appointments? Because I think there could be a pick-up from the 1st of June, and if primary schools do come back on a larger scale through July, you might get quite a rise in demand.
So first of all, actually, one of the things that's been really positive about the last couple of months, surprisingly, is that we've been getting some real success in recruiting permanent staff. So, and that's surprised us all. I think maybe the fact that people are feeling that there's quite a bit of uncertainty out there, that maybe having a permanent job rather than being an agency worker maybe has its advantages. So we've had new applications, and we've also had some of our agency staff wanting to go permanent with us. So that's really good. If we did need additional capacity, we need to use agency staff for that, to be honest. We wouldn't be able to bring people in quickly enough. There's going to be some challenges, obviously, because if we need additional capacity, then probably neighbouring authorities will also need additional capacity. And as you say, it's difficult to recruit social workers at the best of time, and agency social workers are always a bit in short supply. I suspect we'll be able to get some flexibilities about some of the people that we might use to do some of that initial support work. So they have, if every local authority is struggling with this, I think the DFE will relax. We have some children's practitioners who are highly skilled who can't do some bits of work. I suspect there might be some relaxation around that. But, to be absolutely honest with you, we have got capacity at the moment. So it's a question of, seeing how it goes on a week-by-week basis, really. We can also think about perhaps moving some of the workload around to different parts of the service that may have a bit more capacity as well. So to undertake assessments and so forth. So we'll use our own resources as far as we can. And if we do need to do anything else, then we'd go to the agency market to try and recruit additional staff.
Thank you, Councillor Robinson. You still have your hand up. Do you have another question?
No, that was all. No? Thank you.
Thank you very much. Okay. I have no other hands up, so we'll now move to the next item. The next service area we'll look at is education. Jonathan Lewis will speak to this item and take any questions. Jonathan, would you like to provide an update to your report or go straight to questions?
Chair, if it's okay, I'll just provide a very brief update. Thank you for giving me the opportunity to cover where we are with education. Just to start off, it is Thank a Teacher Day. So I would like to celebrate the fantastic work that has been going on in our early year settings and our schools and FE establishments with all members of staff, because I think it's quite amazing what they've done to be able to continue to operate and meet the needs of our most vulnerable children. So I just thought I'd start with that fact. I think in terms of my report, it runs you through the situation we're in. We're definitely in a recovery phase now. The feature that Peterborough has been incredibly strong on is that throughout we've had very strong collaboration. I've worked very closely with the academy trusts within the local authority. We've shared ideas and certainly had a collective approach to the way we deliver education. Obviously, what is key at the moment is the reopening of schools. There is a plan for, in the week commencing the 1st of June, for all early year settings to open, primary schools for selected year groups to open as well, and we will see some other opening of secondaries and special schools across the rest of this academic year. Critical to that decision making about reopening schools is the scientific evidence, and at the moment we're planning with our schools about what that reopening looks like, and until the 28th of May we obviously will not be in a position to confirm that schools will open, and as soon as that scientific evidence is available we will obviously consider it locally and decide how we will open our schools at that point. So huge amount of planning has gone on, very much a feature of collaboration across the city. I think we're very well placed compared to other local authorities in the way we've worked, and obviously we're excited about getting children back into schools, providing it is safe to do so. Thank you, Chair.
Thank you, Jonathan. Councillor Day, you have a question, please? Seem to have lost Councillor Day. I'll move on. Councillor Bisby, we'll come back to you, Councillor Day.
Thank you. I would just like to ask, this has come in the middle of some important years for some of the children, and the ability to learn at home for some, especially the vulnerable ones, is really hard. So I'm just wondering if the vulnerable don't get back, because it's usually the vulnerable ones that would be likely to not want to go to school because of potential of catching COVID, or maybe somebody in the family. Is it likely that they'll be repeating the years, and will that have a knock-on effect for other years coming in?
There's no intention at the moment around repeating years. At the moment, the government are just focused on that reopening phase. So we're looking very closely at that. Having spoken to lots of schools, they are really focused in on vulnerable children, making sure they know how their students are going on. Lots and lots of our schools have made very effective offers for home learning. They've tapped into some of the national initiatives around lessons at home. We're in the middle of sourcing laptops from the Department for Education, as Lou's mentioned, to support those children. I think when schools fully reopen, there will be a re-establishment phase, and we will have to think very closely about those children that have missed education and find ways to support them to catch up. So I think at the moment the focus is on that reopening, but clearly, and a key focus for us in Peterborough is making sure those children that have lost out are supported to catch up.
Thank you, Jonathan. Before I move on a bit further, we've got a lot of questions on this particular topic. I think that was something we expected. So please, can you just ask one question at a time and keep it brief and to the point? So as Jonathan, again, you can answer as quickly as possible and keep to the point. And if you have a question at the end, we'll come back to you for your second one. So go back to Councillor Day. Are you with us now?
Hello, can you hear me okay?
Yes, yes.
Thank you, Chair. I just wanted to compliment and welcome Jonathan Lewis's guidance in yesterday's media statements in allowing head teachers to make individual decisions in reopening schools. Do we know how many schools at the moment plan to reopen? It sounds like we're not quite sure. And what has been the overall response from head teachers with regards to reopening? And do we know what's happening with PPE for schools in preparation for reopening those schools? Thank you.
Okay, Jonathan.
So we're just collating information at the moment on how many schools will be open. I think in that early stage of June, there are no schools that are saying they're going to be closed. We are fully committed to getting children back into school, providing it is safe. We will monitor that, and at the end of the week we'll have a much better position about the plans and the way they work through. We have today been delivering PPE to all schools in the city and into early year settings. So, you know, there will be good coverage to make sure that they have what they need, and PPE is only required where children have symptoms and are being isolated, ready to be picked up by their parents. So we have that covered.
Thank you, Jonathan. Councillor Dowson, please.
I'm mute. Can you hear me now? No?
Yes. Can you ask your question, Councillor Dowson?
Okay, the office, it's about reopening of schools. I'm wondering, since the officer's report, have they taken into consideration the British Medical Association's view that the threat from the virus remains too high for the schools to be run safely? A view shared by the National Education Union and the governments of Wales, Scotland, North Ireland, plus a number of local authorities. Have officers seen any advice from the SAGE committee on return to schools? I haven't seen any. I don't think any has been published. I think that need for more transparency to be provided to parents and staff so that they have more confidence in this decision. And lastly, if parents and staff share this view of the risk to the...
I think we've lost Councillor Dowson. Could I ask the team to try and get Councillor Dowson back on again? And Jonathan, I don't know if he can hear us.
I don't know whether, if I might, Chair, I'm sorry to interrupt, but it could possibly be that Councillor Dowson is using his Chromebook, and the Zoom meetings on Chromebook are not very, very good at all. And that could be one of the reasons.
Thank you. I think we'll have to wait to get him back and get him to answer that question again. While the team try and get him back, we'll go to Copti Vitesse, please.
Thank you, Chair. It's not a question to Jonathan Lewis and his team, but it's a commendation for the guidance that has been issued. Has been robust, it's been clear, effective and reliable. And I know our schools have really, really valued that support throughout this. So it's commendation for the guidance that's been given has been excellent. Thank you very much.
Thank you very much. And we'll move to Councillor Skipstead. If the team could just let me know if Councillor Dowson comes back on. So I've got Councillor Skipstead now, please.
Yeah, sorry to interrupt you just at the moment. What we've done is we've switched Councillor Dowson's video off in the hope that that will improve his audio. So if you'd like to invite Councillor Dowson back again, hopefully he'll be able to re-ask his question now.
Okay, we'll go to him then now. And Councillor Dowson, if you can hear me, would you like to ask your question again? Sorry, we lost you. I don't hear him, so I'm going to move on, and then obviously if he comes back we'll try again. So we've got Councillor Skipstead now, please.
Thank you, Chair. My question to Jonathan Lewis is there's clearly going to be issues around cleanliness and hygiene in schools when they do go back. For example, extra cleaning products and so on. And is there any planned extra funding to improve this? I've heard this is happening in other countries, and it may be essential to ensure a safe return to school for children and teachers. So, for example, if they have to do a deep clean after a case that's been identified, that kind of thing, clearly they're going to need some extra money for that. Thank you.
Jonathan, please.
Yeah, there has been today funding made available. There's been an exceptional circumstances grant. Unfortunately, that does run out at the end of this month. So we have been pushing the Department for Education quite hard to make more money available, and we're expecting an announcement at any time. We are supporting schools with cleaning. Just today, I've sent out some advice about what a deep clean should be, the products they should be using, and we are trying to help them source the right cleaning materials to support them.
Thank you, Jonathan. Co-op T Cantley, please.
Thank you, Chair. First of all, may I
thank the Service Director for Education for the quality and the frequency of his advice and guidance to head teachers throughout the pandemic, which has provided a great deal of reassurance and support, and which I know has been very much appreciated by school leaders. I'm sure we'd all agree that school leaders and their staff deserve tremendous credit for the ways in which they creatively embrace new and innovative ways of supporting children's remote learning through virtual lessons and utilising online learning platforms to best effect, whilst providing vital education for vulnerable children and key workers' children in schools. My question, though, is what is your assessment of the limitations of the scientific evidence that's currently available? And in the light of these limitations and the views of the BMA, how is the unknown degree to which children could be significant asymptomatic carriers informing risk assessment planning for schools, opening their provision to increased numbers of pupils next half term?
Thank you, Jonathan.
I may defer to Dr. Liz Robin to maybe answer the technical side of that, but from a perspective of education, I'm very minded of the letter from the BMA. We've seen that, reviewed it. The information that's come out from the Department for Education to date has been fairly light on scientific evidence. What we've been told is on the 28th of May, there will be a detailed explanation of how the science would support a reopening or not, if that's the case. And obviously we will then look very forensically at that, talk to our school leaders, and then obviously be very minded of that request to open. So we will look at that, but at the moment there's lots of information out there from all sorts of directions. We are very focused on the department and the government advice and guidance coming on the 28th of May.
Thank you very much. Councillor Haynes, please.
Thank you, Chair. You mentioned earlier about delivering PPE to all schools, and I think you said that was because it's only required if contact is made with a child who falls ill at school while they're waiting to send them home. But I was wondering if any schools had expressed a desire or contacted the local resilience forum asking for PPE more generally for their staff when they return, because of the contradiction in the rules about social distancing and how it seems to have been accepted that this just can't happen in schools. So are there any schools seeking more PPE for use more generally in schools?
We haven't had a huge amount of issues around that. Obviously, the numbers in schools at the moment are very low. The guidance that have been issued to schools is very clear that they don't recommend that you wear PPE generally when you're in school, and that's the guidance that's out there at the current time. The only exception would be in our special schools, where we have children with some more intimate care needs and other challenges that we need to support in a different way, and we are looking at a slightly different offer we will make to them. But overall, no, schools have been very grateful. We had to source it at very short notice. It is made available for them, and we will continue to make it available for them if they need it to support them. Obviously, what we don't know is the guidance may still change again, and obviously we will respond to that guidance.
Thank you. Councillor Goodwin, please.
Hi, Jonathan. Jonathan, what I'd like to know is, I mean, I know this is going to be a massive job for you in the reopening of all the schools and, of course, the academies. And how much will you need to collaborate yourselves and the department with the RSC to make sure that everything is done properly in respect of our children?
Jonathan?
Yeah, I think that's a very good question. Obviously, a lot of guidance is driven by central government. I have every other day I'm meeting with the Department for Education. We are going through concerns and issues. The Department for Education also join our Zoom meetings we hold with Academy Trust CEOs, which I'm part of that group, and we are working collectively to work out the best way to open. Guidance is changing rapidly, so that communication link is absolutely critical. So we work very closely with the department, and I think it's a very strong relationship we have in Peterborough with the RSC.
Thank you. Councillor Simons.
Thank you, Chair. Jonathan, I was just curious of secondary rural schools and school transport to make sure, obviously, say social distancing will be catered for on school transport. Have you got that in hand, please?
Jonathan.
Thank you. So yes, we have. The current situation with secondary opening is that there's a requirement for year 10 and year 12 pupils to have some face-to-face time with their teachers over the rest of this term. It's not a come in on the first day and stay in the rest of the time. It's a very different model. Obviously, there are still key worker children and there are vulnerable children attending those schools. We continue to provide transport for those that need it. We have socially distancing using the vehicles that we have, and we provide advice to our drivers on how to deal with those incidents. So it has been covered. We continue to support our homeschool transport providers throughout by continuing to pay for their support because they're critical in longer term. But it's certainly been part of our thinking, and as schools start to reopen again, we will certainly continue to monitor and make sure social distancing where we can is applied in this homeschool transport.
Thank you. Councillor Howard, please.
Thank you, Chair. Good evening, Jonathan. My question is, obviously, when we get the final guidance, there might be a difference in interpretation between some of the schools, some of the academies. Will we be collating feedback from all the schools to try and establish a bit of best practice? Like, for instance, to give you an idea, one of the Hampton primaries is looking at changing its hours to 8:45 to 12:45. So will things like that be picked up by you and sort of fed back to other schools to share?
Jonathan.
Yeah, we're doing a data collection imminently. By Friday, I hope to know what everyone's doing. Obviously, Academy Trust have discretion to deliver as they choose. We've given our schools some flexibility around the way they operate. I think our commitment has been, though, to follow the national guidance as much as we can. And I think the strength of collaboration we have, we do meet with all the CEOs very regularly, is that we're starting to share. And we went through all of the different schools the other day to try and find consensus and challenge each other if we're not doing what we should be doing as well. So I think there's a really healthy relationship and it works incredibly well in Peterborough.
Thank you.
Thank you very much. Councillor Robinson, please.
Thank you. So my question is about the free school meal voucher scheme. So you mentioned in your report on the 20th of April that there had been issues, and I think most of them were in the press, and you have fed those back to the government. So thank you for that feedback, because I think it needed to be said. But it said it caused issues. So I just wondered if you can reassure us from your feedback you've had from heads, what that looked like on the ground, and reassure us that no kids kind of went hungry, were delayed in getting a lunch arrangement. And what is the picture now? Thank you.
Jonathan. When the system initially came out, it was had some challenges in terms of bugs, not being able to sign on. Our staff were having to log on in the night to try and get access, and we were struggling with the range of vouchers. There was a very limited amount of supermarkets that were out there. We were aware of some issues when vouchers weren't finding their way through to parents. We encouraged our schools to find other routes, and that has led to some duplication to make sure families got what they need, particularly over the Easter holidays. We followed that through with agreement from the Department for Education that would happen. And since that time, and subject to us keep challenging, we the last 2 days, because we ask schools every day to escalate to us any concerns. The last 2 days we've had no concerns across Cambridgeshire and Peterborough. So I think the system is improving. We've been well supported by the MPs who have been writing on my behalf. And again, we continue to ask the Quest schools to tell us when there are issues, and we do get them resolved.
Thank you, Jonathan. Councillor Wiggin, please.
Thank you, Chair. I wanted to ask about teacher well-being. We all know teaching can be a stressful job at the best of times. I come from a family of teachers, so I see this firsthand a lot. But I've also seen, as a key worker who is unable to work from home, how much extra stress and anxiety it's causing for staff. Is there enough in place to support teachers during this time? And also, our teachers are doing a fantastic job in keeping schools open through holidays to support those higher education and those who are families of key workers. Are we making sure teachers in those scenarios are able to take their holidays and make sure that they are rested and recovered as well? Thank you.
Jonathan, please.
Yeah, I think it's been a very regular conversation we've been having at our various groups to make sure there's support there for teachers. For instance, we, as a local authority, we opened up our employee assistance programme to the maintained schools to make sure there was an opportunity to access counselling support, advice and guidance where they need it. And I know many of the Academy Trusts did the same. In terms of the timing, we have lots of schools obviously have done brilliant things by covering the holidays. Lots of them are run rotas to make sure that if they do work in that time, they get the time back another time. And we ensure it's fairly spread across everyone. But there's been a huge commitment. We are encouraging them to think very carefully about their time and think about how their staff do get a rest. And we will continue to provide support and advice and guidance to make sure teachers are supported, because obviously this is a really challenging time, like other key workers, to make sure that they're ready to go. And it's going to be very challenging going back into a new system where we'll have some children at home still, we'll have some children in school, and they have to support both. So we've got to be very minded of their workload.
Thank you. Can I just remind everybody to keep their questions as brief as possible? We've got a lot to go through, and we've got 4 questions, I believe, left on this topic, and then we'll move on. So, Councillor Barkham, please.
Thank you, Chair. Jonathan, just a question with regards to placements and availability in Peterborough schools. I know previously that there's been a shortage of places available. So we've had children who've been forced to be homeschooled. Since we've had this potential temporary change of culture regards education, people being at home, have you been made aware of any families who've decided to potentially keep their children at home? Or are you aware of any numbers, if or when schools fully open, hopefully in September? Do you have any idea of numbers and have any of those families decided to keep their children at home due to this scenario? Thank you.
Thank you. Jonathan?
We haven't had any a significant change in what we call electively home educated children. Parents have to make a declaration that they wish to take them out of the school system and educate them at home. I'm very minded of that area, though. We need to keep a really close eye on it. If parents choose to do it, that's their choice. Obviously, one of our roles is to have some oversight and monitoring of that, and we will do that. But I'm happy to come back to Scrutiny in the autumn with some data and share if there's any changes at the moment. But I'm not aware of a massive change at the moment, particularly as schools are closed technically in terms of education. So I expect that may change in the autumn.
Thank you. Councillor Ellis.
Thank you, Chair. Jonathan Lewis, can I just ask you a question regarding if there is a suspected case of the symptoms in a school from a child or from a teacher, and what are there rigorous guidelines, procedures in place to deal with that? And even before that, there is testing, for example, isolating the area where they were and extra cleaning, etc. Can you just explain a little bit more around that? And also in cases where there's a positive test for the child or the teacher.
Jonathan, please.
Probably not the time for me to go into lots of detail about it. What I can reassure Councillor Ellis is that there is very clear guidance out there. It's just been recently updated. We get fantastic support from our public health team, and I've just sent out some more information today to schools about how you deal with cases in school and the approaches. We're also very well supported by a public health telephone number, which schools can call at any time, get through to an appropriately qualified person to give them advice about how to deal with the various scenarios, and there are lots of scenarios. And of course, we are advising as a local authority on cleaning, and if closure is appropriate, obviously we're supporting with that as well. So be reassured, we do follow the guidance, and we always seek guidance where we don't know answers or whatever.
Thank you, Jonathan. Councillor Robinson, you've got your hand up again, please.
Yes, if I can have a second question, please. I noticed in your report on the 20th of April, Jonathan, you mentioned a little bit of an issue around alternative provision and the risk of perhaps one having financial difficulties. Could you give us an update on how things are going in the rather sort of trickier scenario of alternative provision and how it's going moving forward?
Jonathan, please.
Yeah, the report as written is across Cambridgeshire and Peterborough. That particular issue related to Cambridgeshire rather than Peterborough. Our pupil referral unit, now called the Richard Barnes Academy, has worked very closely with us and is working with the children on alternative provision. And we continue to monitor those that we place independently of that, as schools do. And there is appropriate safety and wellbeing checks. And we don't have any financial concerns or issues around those providers at the moment. But we may see some of that when we come back in the autumn. So it's going to be an area of focus for us around alternative provision.
Thank you. I've only got one question left, and then we're going to go back to Councillor. Which councillor was it we missed? Anyway, we'll go back to him in a minute. So we'll go to Co-optive Cantlian, please.
Thank you, Chair. I'd just like to comment further that whilst the scientific evidence would seem to suggest it's very unlikely that there could be a serious outbreak of the virus in a primary school, we don't seem to know the extent to which primary school children could become significant asymptomatic carriers of the virus and cause an outbreak in a local community, or know how their asymptomatic carrying of the virus could be traced in such an eventuality. And so even if the R rate remains below 1, the question remains as to how safe it would be for primary schools to resume fully before the end of the next half term, in view of the limitations of the scientific evidence that's currently available and the caution being expressed by the BMA, and in view of the potential impact of resuming fully, not just on the health and safety of primary school children and staff in school, but on the local communities which those schools serve. I just wonder whether Jonathan would like to comment further on that issue.
Jonathan, if you could be brief, please.
Yeah, I think one of the announcements that has been made today by Boris Johnson is that track and trace of COVID-19 is going to be one of the critical issues that needs to be in place. You're quite right around asymptomatic and whether that's actually being able to be monitored and worked its way through. That again is what we are expecting to get some information about in the DfE report on the 28th of May. And again, we will be reviewing that very thoroughly and working with our school leaders at that point, because we need to understand the risk both to our children, the community and our staff in schools.
Thank you, Jonathan. Just so everybody knows, from a meeting point of view, we should be very close to finishing. We're obviously a long way off that. And I appreciate with the education, that was a very big topic for you, Jonathan. But I will ask you, Councillor Dowson, when he put his question over the phone, did you get most of the question? And would you like to answer it if you did?
I think I got the majority of it. So I think one question I've already answered is around the BMA view. Councillor Dowson suggested that there is evidence out there from the BMA, the British Medical Association, that it's unsafe. We're very minded of that. Again, we're waiting for the DfE to give us a view, and that will include the evidence from the SAGE group about the safety that would be entailing with reopening the school. I think I picked the end of the very last part of the question was around parents. Just to be really clear for councillors that the education offer that will be made from the 1st of June, if that's when we're open, will be optional. It's not a requirement for schools to attend. We will not be processing attendance fines during that period. So parents will have a choice around whether they send their children in or not. So hopefully that's answered the question that was asked.
Thank you, Jonathan. I think you need a rest after that, but thank you very much for your professional answers. I'm sure everybody's very thankful for your time. Thank you very much. So we're going to move on now and give Jonathan a rest to the next service area, which is Coordination and Response Hub for Shielded and Vulnerable People. Adrian Chapman will speak to this item and take any questions. Adrian, would you like to provide a brief update to the report or go straight to questions?
Thank you, Chairman. Good evening, members. Really great to see you. And I will keep this brief following Jonathan's mammoth effort there. You'll be glad to know. So just to remind everyone of the role of the county-wide hub. The county-wide hub covers both Cambridgeshire and Peterborough and is focused exclusively on supporting those that are most vulnerable to harm as a result of coronavirus. So these people are clinically extremely vulnerable. To fall into this category, people are generally very poorly or have been in recent past. For example, having recovered or still suffering from some cancers, some severe respiratory conditions, and perhaps being previous transplant patients. So this is a group of people that are known as the shielded group, people that need to stay at home without face-to-face contact for at least 12 weeks, likely to be longer. Across the whole of our county, Cambridgeshire and Peterborough, there are just over 30,000 people that fall into this category. In Peterborough, that number is about 5,250. So a significant number and growing all of the time, as I think Gillian mentioned at the start of the meeting. It's really important and very helpful to us if people go on to register as shielded. It's not compulsory, but what it enables us to do is to reach out to those people, provide whatever support practically or otherwise that we can by means of shopping or collection of medicines or befriending support, or increasingly household chores that are starting to not be able to be completed, which is going to start to affect people's emotional well-being. And so far, 17,000 of that total 30,000 population are registered. In Peterborough, that number is 3,000. So you can see we've still got some distance to travel. We reach out to the registered population very, very frequently, but by means of telephone calls, emails, contact letters and texts to encourage and ensure people to get help and support that they need, but also we reach out to people that aren't yet registered in order to try and encourage them to do so. The county-wide hub has delivered around 9,000 individual requests for help in the time that it's been operating, which is about 8 weeks now. Help in the form of urgent food parcels, help with medicines, as I've said, increasingly household chores, the things that are really going to affect somebody's ability to stay safe and well and to prevent them from having to go outside of their home whilst they're highly vulnerable. The report also mentions that we've been working with our district and city council partners to create a network of local hubs to support other vulnerable groups, not those that are shielded. And in Peterborough, the hub is led by Wendy Ogle-Wellborn. There is a really comprehensive structure in place that is responding to vulnerable residents' needs. The hub in Peterborough has made 1,500 outbound calls since it began at the beginning of April, and has had a total of 570 individual requests for help that have all been resolved. This is perhaps the time also just to acknowledge the support of our partners, which has been just incredible and overwhelming. Citizens themselves stepping forwards to help out their neighbours or in their own communities without being asked to do so, but also our voluntary community and faith sector partners, and our social landlord partners, particularly Cross Keys Homes, who have been an exemplary partner to us in our effort in Peterborough by helping reach people that perhaps we find it more difficult to reach. I'll leave it there, Chairman, and obviously happy to take any questions.
Thank you. Any questions at all for Adrian on this one? No? Okay,
sorry, Chair, if I could just interrupt, just to let you know that Parish Councillor Susie Lucas, co-operative member, has left the meeting.
Okay, thank you very much. Okay, so there's no questions on that one, so we'll move on to the, oh no, I've got Councillor Bisby's got his hand up. Councillor Bisby.
Thank you. I'm just aware that vulnerable people are also including people with diabetes who seem to have a worse outcome if they do catch coronavirus. Are those people being contacted, or are they on the contact list?
Adrian, please.
Yes, thank you, Chairman. Thanks, Councillor Bisby. We are receiving and triangulating data from a wide range of sources. So people that are currently suffering from a wide range of conditions, whether they fall into the shielded category or not, are being contacted proactively, providing we know of them, and there is some fairly extensive data being made available across the system to enable us to reach these people. And we're also really keen to make sure that everybody knows how to reach us, both in the county-wide hub, but also in the local Peterborough hub. And if I could ask all members to continue to use social media to advertise the fact that we're here for the duration of the pandemic and during recovery and beyond. keen to support anybody that might fall into any of those vulnerable categories, please do so. We've appreciated your support so far. We'd love for that to continue.
Thank you, Adrian. Councillor Howard, please.
Yeah, thank you. Just to say that I've put referred a couple of residents to the hub, and I really can't talk highly enough of the incredible work you're all doing. So just to say thank you so much, really.
Okay, thank you, Councillor Howard. Speaks for a lot of us. Thank you very much. Okay, I've got no further questions on that one, so I'm going to move to the next one, which is the next service area that we will look at is communities and partnerships. Adrian Chapman will again speak to this item and take any questions. Adrian, would you like to provide a brief update to the report, or would you like to go straight to questions?
Thank you, Chairman. This will be even briefer, just to say that our normal services in the Communities and Partnerships Directorate, where they can, are continuing, but have responded and adapted, I think, really effectively. So we know of a small increase in reports to our domestic abuse service, but actually demand is being managed extremely well. We've got capacity in our service at the moment to take any incoming inquiries, and they're being responded to really effectively. Our CCTV services continue to operate 24/7, unaffected by the pandemic. And perhaps just positive to note, our adult skills service delivered through City College has continued to adapt and provide online learning to adult learners. 600 learners still continuing to participate online through digital learning opportunities. 90% of young learners also engaged online, those young learners that are supported through City College. And just finally, a plug to look out for a new service that we've developed through a collaboration with City College, Cambridgeshire Libraries and Cambridgeshire Skills to offer other opportunities to people who are shielding or otherwise at home at a time when they're starting to feel very vulnerable. So this will be advertised in the coming days, but opportunities to participate in learning, to socially interact, to take a look at how people can look after their emotional health and well-being. So a really important additional service that's come out of this current pandemic situation. Thank you, Chairman.
Thank you. Okay, questions, Councillor Iqbal, please.
Thank you, Chair, and through you. Thank you for your report, Adrian. As you are aware, the report was issued on 26th of April 2020. Today is the 20th of May 2020. My question is, how successful have we been in delivering the support or services identified in your report from 26th of April 2020 until today?
Adrian.
Thank you, Councillor Iqbal. So you're absolutely right. There's a number of weeks that have passed, and I am generally a pretty busy person, but I don't think I've ever been busier than right now. And I'm speaking for myself, but also for the hub service that I'm delivering. We are responding to hundreds of incoming calls a day. I think 4,000 incoming calls since the hub began. Our outbound calls number about 7,000 a week, so that's reaching people who are shielded with proactive contact to make sure that they're supported, and the reference to 9,000 requests for help resolved. You know, I think unanimously, really, our feedback, the feedback we receive is unanimously positive. People are amazed, I think, by the amount of support that's provided, the type of support, the range of support. For me, it's important that when we come through the other side of the pandemic, that we ensure that the really positive features of the way we're all working together now in partnership, in collaboration, in Peterborough and beyond are sustained, because there's so much incredible effort happening on the ground, and it would be a real shame, I think, to lose it. Obviously, in the next Scrutiny Committee report, you'll get a much fuller update of some of those more positive and tangible outcomes.
Thank you, Adrian. Councillor Howe.
Thank you, Chair, and thanks also, Adrian, for your report and also for your incredible work, which is greatly appreciated. I just wanted to talk about, as we're moving forward, and the reintroduction of services as the situation hopefully improves. The kind of inquiries I get through now as a councillor have changed a bit because people have been locked down for so long. Different things concern them, I think, than had previously. I'm just wondering about the capacity of the enforcement team. We have things like, some of them are police issues like speeding, but bonfires, dumping of black bags, cannabis use, noise, people breaking lockdown, and people constantly breaking into playgrounds as well. And I wondered what challenge that's presenting for enforcement, and is enforcement sufficiently resourced to be able to deal with this? Thank you.
Thank you, Adrian.
Thank you, Chairman. Thanks, Councillor Howell. An absolutely pertinent question, and we're seeing all sorts of different types of ASB and crimes emerging through the current situation. An incredible increase in the number of noise complaints, for example, which if you can understand, I guess, with people being locked down at home. So I'll ask Rob to respond in more detail in a moment. But what I will say is that one of the great things that has come out of the current experience is, again, the sheer volume of collaboration that we're seeing. I was involved in a conversation earlier with colleagues, including someone from the police, and a real change, I think, a real willingness to work collaboratively on some of what felt like quite entrenched challenges that the city has faced for a long time. We were talking specifically about some of the ASB issues in the city centre. And it's sometimes felt that that's fallen to our organisation to resolve with support of the police, but not necessarily alongside us. And there felt like a very different spirit, a very different tone emerging. And I think that's been born out of just the value of working together in this almost forced environment. But it's really proven, I think, to everybody that there is great value in collaboration, because we can do so much more together than we can do apart. So I feel confident. I think recovery will be long and sometimes difficult, but I think we've got a really flexible and creative collaborative approach here that we can turn to really approach some of these difficult issues head on. Rob, I don't know if you want to add anything around the volumes.
Yeah. Yes, thank you, Adrian. Thank you, Councillor. Forgive us, we've got. Can you hear me? Okay, good. Thank you very much. So yes, we have seen rises. I think it's fair to say in some of the more visible challenges around the city in the past month. ASB, we've mentioned already, has been on the increase. We've also started to see some rises around fly tipping, and for that reason, we're looking very closely at how we might redeploy resources back into tackling that. We've got environmental crime officers are now already back on the streets and are investigating. It's been helped very much by the reopening of the recycling centres. But the next plan is to look at how we can get things like parking enforcement back online and officers dealing with some of the antisocial behaviour challenges that you talk about. Now, that needs to be thought through very carefully about when we do that. We've just joined a group looking at how we start to pull together the recovery now, and it needs to be phased and worked through appropriately so that we can deal with the reopening of car parks, for example, at the same time as we're advertising the reopening of the city. So it is very much in hand. What I will say is that it's closely monitored by my staff, and where we see challenges that pop up, as we did last week in Peterborough around a travelling encampment, we made sure we released the resources so that we could grip it and deal with it promptly. Thank you.
Thank you very much. Adrian, anything more to add? Are you finished there? Let's be finished. Councillor Wiggin, please.
Thank you, Chair. Yeah, wanted to ask Adrian, I know it's on your radar because I've emailed about it previously, but is there any update on support for community centres who are struggling financially due to loss of bookings due to the ongoing crisis? Thank you.
Yes, thanks, Councillor Wiggin. Absolutely. We, like any organisation at the moment, we know that a number are struggling financially. Obviously, with the community centre reliant on bookings, they're severely affected. So we are continuing to discuss this issue internally. There are a number of options that I think we'll be able to come forward with fairly quickly now. There was a positive discussion yesterday. They need further work, so I won't go into too much detail this evening, but we are minded of the concerns and need to ensure that our really rich network of community centres are supported to be sustainable beyond the pandemic. So if you could just give me a few more days, we'll come back to you with a really positive, I think, set of offers for our community centre communities.
Thank you very much, Adrian. Councillor Sandford, please. Oh, he's gone. No, he's took his name off again, so there's no more questions on that one. Anybody else?
Yeah, sorry, I was actually on mute, so I'm taking it off.
Right.
Just picking up what Rob Hill said about traveller encampments, because I think I'm aware of the one he's referring to, which was a big encampment on Manchester Square. Now, his team has been working quite hard to get the travellers moved off, but what's actually happened is that they've left behind masses of bags of garbage and garden waste and a whole range of things. Now, what my constituents are saying to me is that if anyone else were to dump loads of things on a piece of council green space, they'd be prosecuted by the council. So I just wondered if Rob can say, is the council able to take any action against these people who are dropping all these things?
Rob, are you going to come in?
Yes, thank you, Councillor Sanford. As with all investigations of this nature, we will thoroughly investigate. If we identify a named offender, we'll deal with them. But when it's left at the end of an encampment like that, often the evidence is quite challenging to pin it back to an individual, and that's what the teams will be trying to do. We have cleared that site, I'm pleased to say, and we're in the process of making sure it's defended appropriately so it won't happen again.
Okay, I've only got one more question. I believe this will be the last question. We could move on if you could, please. Councillor Wiggin, do you have another question?
Yes, please, Chair. Thank you. Wanted to ask about citizens' advice. Are you able to update us on what situation citizens' advice are in and how they're coping with the ongoing crisis, given the reduction in funding from us that we agreed in the budget?
Yes. Thank you. So I remain in very close contact with Keith Jones, the CEO of Citizens Advice, and perhaps fortuitously, actually, the organisation adapted very quickly to a new operating model before the pandemic began, as a result of needing to rethink their delivery arrangements as a result of the new budget. And they are reporting a huge increase in demand, but are absolutely coping with that, I think, remarkably well. A significant increase in demand relating to employment or financial matters. So Keith continues to provide me with those updates. We haven't yet so far had to intervene. He's coping, and the organisation is coping very well. A fantastic network of volunteers and so on. Yeah, we'll continue to maintain that relationship.
Thank you very much, Adrian. Thank you for your answers, and thanks, Rob, as well, for your answers. Thank you. We'll move to the next service area, and that is public health. Dr. Liz Robin will speak to this item and take any questions. Dr. Robin, would you like to provide an update to the report or go straight to questions?
I'll provide a brief update, and I'd like to start by thanking the communities in Peterborough. We have 371 confirmed COVID-19 cases to date in Peterborough, and that's about 185 per 100,000 population. And that is below both the regional, East of England, and the national average. And the reason why we have a low rate of cases is because our communities have followed the rules, and they moved quickly into the stay-at-home rules and responded well. And I know how many of you and how many of the community leaders have supported communities to do that. And actually that has resulted in definitely saving some lives and helping protect our NHS in Peterborough. So it's a big thank you to everyone that I'd like to start with, because that was the big public health intervention, was what the communities did, what everybody did. So moving on to the service, just a couple of key points on what we're doing. The specialists on the public health team are working right across the system to offer public health advice to other council directorates, wider public sector groups that Gillian talked about earlier in the Local Resilience Forum. And that's to support the COVID-19 response. And we're also providing analyses and data on trends for COVID-19. A public health specialist jointly leads the Local Resilience Forum PPE Hub, which receives supplies from the national PPE stock, and people have mentioned that earlier, that provides emergency supplies when health and social care providers can't access through their normal route. And finally, we're working closely with our Director of Customer Services and with the Regional Public Health England Health Protection Team on the developing plans to support contact tracing and management of local outbreaks. So those are just some highlights of what the team's doing at the moment.
Thank you very much, Doctor. Question is cooperative member Bull, please, I've got.
Thank you, Mr. Chairman. If I could ask Liz about the third bullet point on her report. Who or what defines eligibility and quantities of emergency PPE to our local organisations? And is there still a relative shortage, given that national stockpiles were once virtually depleted?
Dr. Robin, please.
Okay, the eligibility is defined by the National PPE Plan and quite a wealth of national guidance for PPE requirements in different settings and for different providers. There are ordering arrangements for the LRF PPE Hub, which go in through a number of different routes. So from care homes, they'll come in through the ordering route through the council, hospices will come in through the CCG, funeral directors will come in through another route. What we do is public health looks at the orders to make sure that people have a full understanding of the PPE that they're requesting, that it's in line with national guidance, and that the amounts requested are proportionate to the likely need for a week's emergency supply. And that check is done before the order goes out, but it's done carefully. And there is often an interaction with the provider just to help them and to explain to them what the PPE needs are under the national guidance and why, and to help them to order the right thing.
Okay, thank you very much. Councillor Sandford.
Yes, I just wanted to ask a question that's not in the report, but I think maybe it ought to be. It's about the state of people's teeth. What happened is on March the 23rd, all dental practices in Peterborough and across the country were closed, and there hasn't been any indication given so far when they're going to be opening again. What's been put in their place is a series of emergency hubs, but what I'm told is that they are really only dealing with like hyper emergencies and doing things like extraction. So there's a lot of people across Peterborough and across the country who are left possibly in pain and possibly with some quite serious long-term dental conditions. And so I would actually really like to urge, I actually raised this with officers, but I'd actually really urge the appropriate people at the council to make representations, because the government's, talking about opening non-essential shops. They're talking about, opening massage parlours and hairdressers, but dental practices are really fundamental to people's health. So is it possible that the council could make some representations on this?
I would be very happy to, and I know we have corresponded on this before, Councillor Sandford, but to go back to NHS England for the latest plans around this in terms of the recovery plans for the NHS, and provide you with more detail on what the plans are at the moment. So clearly a lot of effort has been put into ensuring the emergency dental access is maintained, but I do absolutely take your points about the other dental conditions and the distress that they can cause. So I would be very happy to go back and try to get you the very latest information on that. I would say that some dental staff have been volunteering into other health and care roles, such as swabbing and other things that are needed for the response. So it's not that people are not doing anything, but they're clearly, it's a very good question, and I'm quite happy to go away and find out more for you.
Okay, thank you, Dr. Robin. Councillor Quayon, please.
Thank you, Chair. And before I ask my question, Chair, I'd just like to establish, if we were to make a recommendation, is the time to do that now, or would it be at the end of the meeting, please?
It will be at the end. I'll ask for those at the end. Thank you.
Thank you very much. Dr. Robin, thank you very much for the inputs that you've provided. In your most recent report, I haven't seen much highlighted about testing. I know that there are various ways that the government and the Department of Health have rolled out in order to try and achieve testing for diagnostic purposes. I've had a number of queries regarding inconclusive testing results that have come back. Now, this does lead to the delay in diagnostic process. What is being done about these tests, and are there any plans to roll out the new tests that have been procured from Roche, the company that seeks to then carry out the antibody testing that has recently been highlighted in the media? Thank you.
Thank you, Councillor. Dr. Robin.
Okay, so I'm not sure I can answer all the detail around the plans for Roche and so on. So we have a testing cell locally that is led by the NHS, and I'm very aware, as you are, of the different sources of tests that we have, which have been the result of the very rapid ramping up of testing, which has been needed nationally. So we have tests that are run in the local NHS, we have tests that are run in the local Public Health England laboratories, and we have tests which go through the national laboratories, such as the very large super laboratory at Milton Keynes. So it's a complex environment. The general feedback in Cambridgeshire and Peterborough is that in general, accessing testing is reasonably good, that we've got to a stage now where when tests are needed, they can be ordered reasonably quickly. But there are delays sometimes in the turnaround of the tests, which, as you say, can lead to challenges with getting the diagnosis established quickly. So for me, I think this has been a very rapid ramping up of testing. I'm not going to give categorical information on the Roche testing because I'm not close enough to that, although I am aware that there's been real progress with the antibody testing, and that would be very welcome in terms of helping us to understand fully the impacts of this pandemic and to move forwards. Yes, I would say that the biggest challenge at the moment is actually the turnaround time for the testing, certainly in the local circumstances. And we are looking very actively at improving that and how we work to highlight and improve those issues.
Thank you very much. Councillor Day.
Thank you, Chair. Sources have told me who work at Peterborough Hospital that they are reusing PPE. They've told me that they put it into a black bag for reuse. Is there a sterilisation process involved in this process? As I was under the understanding that PPE was a single-use resource.
There is national guidance on what PPE can be reused and how it can be reused. So if the hospital is following that national guidance, that is very reasonable, and I assume that they are. I don't know the detail of the individual circumstance that you describe, but there is now national guidance on this.
Thank you. Councillor Robinson.
Thank you, Dr. Robin. My question is around test, trace and isolate. It's a term I've heard, but I'm just not very familiar with where we are at it and when we can look forward to having that here in Peterborough. Now, I know there are developments for now, but in terms of how other countries are doing it, how are we on that journey in Peterborough? And is it something that we're going to be able to look forward to soon? As a teacher, I think it might be something that schools and parents might feel sort of reassured by if it was in place when we go back to school?
Absolutely. There has been some national announcements about this, and in Peterborough, we would have a role to play on working with what's called Tier 1 of the testing system for more complex outbreaks that might need some, in a sense, door knocking in the community, outbreaks in settings. So we do have a local role, and we're working very closely with the regional health protection team on developing that and on ensuring that we have the right processes in place and can link in with the national testing track and trace systems. So yes, it's very active work in progress, and we are fully involved from Peterborough and Cambridgeshire. So I can't give you an exact date because that would be a national announcement, but I can assure you that we're very actively involved.
Okay, thank you very much. Councillor Casey.
Thank you, Chair. I'd like to thank Liz Robin for her response to the email I had about cigarette butts. And I was just wondering, I had residents asking me about whether or not it was a health risk for people to drop their cigarette butts on the floor and persistently do it, and whether or not we could try and get some messaging out to residents, which would also help with the littering as well.
Robin?
Well, what I'd say on that is that because the main sort of guidance around smoking is for people not to share smoking equipment, because clearly that could result in very direct transmission through saliva. The dropping of cigarette butts, the risk would be that there might be some saliva on the cigarette butt, and so if people touched it, then that could potentially be a transmission risk. So that would, but it would be about someone touching, clearing up the cigarette butts, and then they would need to wash their hands well, and so on. So there is a risk there, but I think there are more general risks around littering in terms of people's perception of the environment, their mental health, and other issues. So there are a number of reasons to discourage littering.
Thank you. Co-opted member Leavesley, please.
Thank you, Chair. Liz, you mentioned there were 371 cases, incidents in Peterborough, which is better than regional and national performance. Could you just say something about what the trends show?
The trend in cases is going to be quite difficult to monitor because there's more and more testing, and we know that the cases in the earlier phase of the pandemic were only tested really in hospital, so only the more severe cases, and now we've moved on to much more testing capacity, so lots more people will be tested, and people who are not very ill with COVID-19 and are in the community will be coming back with positive tests. So I think actually we have to watch the trends in test results with some caution as testing is opened up much more widely, because it won't be exactly the same as it was a month ago. Looking at the other trends that we see in the area, including sadly the trends in deaths, we are seeing that there was a bit more of a peak in the first couple of weeks of April, and that the trends are coming down since then in Peterborough. So the trends are generally down, but I'm quite cautious about the actual testing trends, because that will, that test have just been opened up to anyone with symptoms, so that is going to result in a lot more tests being done.
Okay, thank you.
Okay, thank you very much. I've got no further questions. We're going to move on then to the next service area, which is place and economy. Steve Cox, Mohammed Hussain and Graham Hughes are in attendance to take any questions. Steve Cox, would you or one of your other officers like to provide an update to the report, or would you like to go straight to questions?
Thank you, Chair. I'll brief update on the report from me, and good evening, everybody. I won't go through in detail, but I will pull out some of the highlights just to illustrate some of the issues we're dealing with in place and economy. Firstly, the Household Recycling Centre, I think, has already been mentioned this evening, opened on the 11th of May with social distancing measures in place and traffic management in place. And I'm pleased to say that went well last week and over the first weekend that's just gone. But we'll be keeping that under close review to keep an eye on any issues that arise. So that has happened. Last week there was guidance issued on for safer public spaces, guidance from government for green and public spaces. That's been picked up by the city centre recovery team. It's an important part of the guidance to guide the work that team is doing. They're now looking through the task force that's set up, preparing an audit, which they're doing right now, of how retailers, should the guidance allow them to open up on the 1st of June, how they can do that safely, but also how they can do it in a way that economically makes sense for them. And it is going to be a challenge to enable both of those two things to be achieved. But we're working very closely with them to ensure that is possible, and that we get a city centre open again and thriving as best we can within the circumstances. If I can come to the third area, which is Councillor Sanford raised earlier around cycling and pedestrian reallocation of road space. So there was an announcement about 10 days ago, the weekend before last, of 250 million within the financial year to support the reallocation of road space, so the creation of opportunities for more cycling and pedestrian links. That's 250 million out of a 2 billion allocation for cycling and pedestrians. We're doing a lot of work on some of the options that can be brought forward. It's being coordinated by the Combined Authority, and we've been working closely with the Combined Authority on some of the options. We don't know what the allocations are for the Combined Authority area. That's still awaited. But what we don't want to do is wait for that allocation. We need, I think, to be moving on as quickly as we can with some schemes across Peterborough. We've asked Sustrans to do a review of the green wheel to see where there can be some maintenance improvements to make that more usable and easier to use and more attractive to use. We're also looking at putting in place some more white lining to better define cycleways across the city, again, to make it safer and easier for cyclists to use what's already there. And then there are a series of other potential measures that we can put in place around cycle repairs, training, maintenance facilities, cycle parking. We'll be looking at temporary school road street closures, as I mentioned, around vegetation clearance. We're also looking at specific schemes. One we're looking at is Crescent Road Bridge, to see whether there's a way of changing the road space to allow greater space for cyclists. That's work that's carrying on right now to look at the costs and how quickly we can introduce that. And if we were to do that, we would want to put sensors down to monitor the progress and success of that once it's in place. And the final point is just to come back to Councillor Howell's point right at the beginning of the meeting around the rough sleepers and homeless that were in the hotel at Alton. I think picking up Gillian's point, yeah, it was done really quickly within, I think, 24 hours. It was the only hotel that we could use, but there are lots of lessons that we can learn, as ever, from everything that we do, but in that as well. And I'd like to just to say we're very grateful for the support Councillor Howell gave over the period that the hotel was being used. So that's just by way of introduction, some of the points I wanted to make. Thank you, Chair.
Thank you very much. Councillor Sanford then, please.
Yes, I anticipated that Steve was going to mention the cycling question that I asked earlier on. I think my follow-up question to that is quite a number of the things you mentioned were quite praiseworthy things. You know, we need to do things to improve the green wheel and cycleways that we currently have. But what the government, what Ant Shapps was talking about was quite clear. It was talking about reallocation, whether on a temporary basis or a permanent basis, of significant areas of highway space for pedestrians and cyclists, because there has been this massive upsurge in cycling and walking. You know, this could literally be a once in a generation opportunity to capitalise on that. So I think we should be looking not just at taking what money the government's prepared to actually give us, but also the Combined Authority should be looking at its own transport budgets and looking to reallocate money from highways over to pedestrians and cyclists. Can you give us an assurance that that is what's going to happen?
Okay, Steve.
Thank you, Chair. Yes, Nick, I think you're, Councillor Sanford, you've hit the nail on the head in terms of the opportunity that we've now got and the debate and the discussion that's now happening around how we can use this. I think it was mentioned earlier about some of the opportunities that might come out of a very difficult situation. Then this could be one. And I think that's, I know the Combined Authority are very keen and want to support schemes across the county and across Peterborough. And we're working very closely with them to make the case for schemes in Peterborough. So yes, I will take that and give you that assurance that is work that we will carry on doing.
Yeah, just one very quick comment on that. I think my experience of the Combined Authority is they're very good at doing things in Cambridge, but not always in Peterborough. So maybe that could be borne in mind.
Thanks, Councillor. Can you press your hand to speak there? Don't just jump in. Thank you very much. I do appreciate it. Councillor Ellis, please.
Thank you, Chair. Thank you for the report which you've given to us on this. I'd like to first of all thank our City Council workers and contractors, especially those keeping our city clean, including refuse collectors who've been working all during this time. I did have 7 questions. I've reduced it down to about 3, and they're quite short. My first one is in relation to this. At the beginning, I understand we had to reduce the amount of garden waste collections to once a month. Has that now been reinstated to weekly? I know we've obviously opened the recycling centre. And I'll quickly ask the other 2 questions while I'm at it to get it done quickly. Mention New Towns Fund. Can you give any examples of bids that the City Council are looking to put towards that, especially under the COVID-19 area? And also, in addition to Councillor Sanford's question around transport, for those who, not everybody is physically able to cycle or to walk. So during this time when social distancing is important, are we looking at, or is there money available to increase bus transport? I know you're saying about Stagecoach increasing services to enable more social distancing at this time. Thank you very much.
Steve, please.
Thank you, Chair. Still once a month on the garden waste collections, but it is under close review. Talking to the team to get that back as quickly as we can. You're quite right. It went to monthly, so that we could release resources for the urgent black bin collections that needed to be made. On the New Towns Fund, a real opportunity for us to use the New Towns Fund to support the delivery of some of the aspirations and ambitions we've got, particularly around the city centre. There is guidance coming out at the end of the month that will change what government is expecting to see in the investment plans that are coming forward to the Towns Fund so around COVID. So we will be adapting once we see the guidance. But some of the ideas that are already in there, such as around the station quarter, connecting the station closer and better into the city centre, and enabling the improvements of pedestrian and cycle links from each side of the city centre. So, for example, from the embankment and from where the university scheme is coming forward into the city centre, was part of that, and I think will be consistent, therefore, with the guidance that comes through. And again, when we get to the point of being able to have the transformation plan for the city centre, I'm sure there'll be measures in there that we can put into the Towns Fund bid to support the delivery of and support for businesses that are reopening within the city centre. And on buses, yeah, it's this sort of issue around how we can ensure people do want to carry on using public transport. So we will work with the bus operators and the Combined Authority to try to get as many buses running as possible, so it enables safe travelling on the buses, that people can be socially distanced. And one of the first things that we did when the lockdown started was to support some of the employment agencies that were providing workers to food companies around the city, so that there was more space within more buses, so that people travelling were travelling safely. So that was both a public health benefit, but also supporting businesses and supporting residents within the city. So yeah, that is an important point, and an important part of, again, getting the city centre revitalised by enabling people who can't come by any other means into the centre.
Okay, thank you very much. Councillor Wiggin, please.
Thank you, Chair. Yeah, I wanted to ask Steve about the issue of day burning streetlights. We've had in Hampton Vale, where I live, and in other areas, the lights have been on day and night for at least 7 days.
Councillor Wiggin, I'm not quite sure that's a COVID thing for everything, is it?
Related to outstanding faults. So,
Steve, can you answer that one then? I don't think we did that in the COVID one, but fair enough. We'll get it answered now.
Yeah, happy to briefly come back on that if I can. Yes, it was May Bank holiday. I think we had a number of streetlights that were continuing to burn. There's 12,000 initially that we reduced to 6,000. Without going into all the ins and outs of why that happened, there were 2 base stations that all lights connected to base stations. 2 of those base stations were not working. So what we've been doing, the team have been doing now, is to reallocate those lights that are on to other base stations, and the expectation is that we'll get that sorted and those lights off soon. We're working with Telenza on that, who are our contractors. We will be seeking some compensation and resources money back from them for the faults that have occurred.
Thank you very much. Thanks for answering that. Co-opting member Leasley, please.
Steve, as I had the misfortune to fall into the over 70s group, which the NHS is still defining as a highly vulnerable category, and are advising us to maintain social distancing. One of the things that's made life tolerable is the actions by major supermarkets to have dedicated hours for us, which includes social distancing and limiting numbers going in at any one time. In the context of reopening the city centre, etc., could I urge you that in any discussions with sort of major chains, that the point is made that most of us, until we're vaccinated, will still feel very vulnerable and would welcome the continuity of this benefit.
Steve?
Yeah, we'll certainly do that, and it's a really helpful point actually to think about not just the retailers, but also residents and others who are coming in. And actually, I think we'll find a very positive response to that, because we want to encourage as many people to come safely into the city centre as possible. And if we put in place or continue some of those measures to enable that, then we should do that. So I will take that point up. Thank you.
Thank you. Councillor Wiggin, I've got your hand up again. Have you got another question?
Yes, please, Chair. To do with the guidance on safer public spaces, you've mentioned how that's affecting things like litter bin emptying, but is there any guidance on individual citizens being able to undertake litter picking? In particular, we rely on litter picking to supplement the Lensman service in Hampton because there's so much of it. It's such a vast area, and I notice regularly that there's a lot of litter around, and because we've had to cancel our regular volunteer litter picks, it's not getting picked up. Is there any guidance on that?
Thank you, Councillor Wiggin. I don't think the Safer Public Spaces covers that that particular issue. I'm not aware there is specific guidance on it. I suspect the same social distancing would apply and PPE issues would apply. I don't know whether Dr. Robin would comment if there is guidance, but I suspect it's perhaps not that specific. It would be the general guidance that would probably apply.
Okay, thank you. Dr. Robin, would you just like to comment? Is it just as Steve suggests? We lost Dr. Robin. I think we'll have to. You'll have.
I'm here. I'm here. I'm sorry, but could the question just be repeated, please, so I make sure I give the correct advice?
I think, Councillor Wiggin, would you like to? You ask it the best way, then you'll get your question.
Yeah, thank you, Chair. Dr. Robin, I was asking about any guidance that there is regarding litter picking. We have community litter picks that have been cancelled due to the ongoing crisis, whether there had been any guidance issued about whether, not necessarily in groups, but individuals can restart that kind of activities yet?
Like Steve, I'm not aware of specific guidance around that. So I think that's one we'll have to take away and feed back to you on.
Thank you. Okay, I have no more questions on that one. So we're going. Thank you very much, Steve and Mohammed and Graham, for your input and help. We're going to move on to the next service area, which is customer and digital service. Sue Grace will speak on this item and take any questions. Sue, would you like to provide an update to the report, or would you like to go straight to questions?
Just a very brief update, thank you. Good evening, everybody. Just to say, I think our IT, customer services, communications and emergency planning services have all settled into their new pattern of working and are supporting services that you've heard about already this evening in terms of their continued response work, and also supporting the recovery work as that steps up. So I don't really want to highlight anything more than that. Contact tracing, Dr. Robin has already referred to that. And then the only other thing I wanted just to reference was just some work we're doing around health and safety at the moment. You'll be aware that the government issued last week its recovery plan, and associated with that recovery plan were a set of guidance documents around safe working practices and how to create the environments in which people work safe for them. And we particularly picked up the office guidance, and we've translated that into a risk assessment template, and that's been agreed with the unions. And over the course of this week, all across the offices that are open within the City Council, they're being risk assessed, and then actions will be taken immediately to ensure we're compliant with the new guidance, and that staff who need to go into those spaces can go into those spaces and work in a safe way. So that was the only point I wanted to highlight, and very happy to take questions.
Thank you very much, Sue. Any questions at all? No. Thank you very much, Sue. Thank you for your input.
Thank you. Thanks.
We will now move on to the next service area, and that is business intelligence, commercial, strategic projects and financial improvement programme. Amanda Askham will speak to this item and take any questions. Amanda, would you like to provide an update to the report, or would you like to go straight to questions?
Thank you very much, Chairman, and good evening, everyone. I think as we are a bit time limited, I'll go straight to questions. Like Sue, I just wanted to thank my teams for slipping into the new normal behaviour and supporting from the corporate centre all the service delivery teams. So very happy to take any questions.
Thank you very much, Amanda. Any questions? Councillor Goodwin, please.
Chris, I'm just contacting you to say that my battery it's showing low and I can't charge it. So if I do leave, it's not because I want to, it's because the battery's gone. Thank you.
Thank you very much. Any questions? Thanks for letting me know. No, Amanda, thank you very much. We will move on. The next item for service area is that of resources. Peter Carpenter will speak to this item and take any questions. Peter, would you like to provide an update to the report, or would you like to go straight to questions?
Thank you, Chairman. I'll just do a very quick update. We have and will continue to support the delivery of our vital services to our community and normal services and COVID-19. We're ensuring the financial resources are in place and will be in place throughout the year, ensuring that delivery will be maintained. Three main things from me. One, on a monthly basis, we actually do returns now to MHCLG. The latest return was on Friday, last Friday. At the moment, we've got around £20.7 million worth of pressures. We have at the moment £11 million of funding received from MHCLG. However, MHCLG are now looking at the returns that came in on last Friday to assess what additional funding will be made available to our sector. In terms of rural and small grants, we've now made 2,358 grant applications to our business community. This is a 97.36% delivery rate and has ensured that around £28.5 million worth of support has been given to business in the Peterborough area. If we add that to the 1,274 businesses who have received national non-domestic rates support, we've given over £65.5 million worth of support to business in the last 6 weeks to hopefully keep them running until we start to move out of lockdown. I think that is a very key point in terms of finances. At the moment, we're asked to put numbers back to central government based on, it was originally a 3-month lockdown, then it's become a 4-month lockdown. Figures will change and estimates will go up if lockdown continues to expand slightly. In terms of registrations and bereavement, as you see from my weekly reports, we have capacity in both those areas at the moment. Happy to take questions now, Chair.
Thank you very much, Peter. Co-opted member Ball, please.
Thank you, Mr. Chairman. Peterborough has so far received an additional 10.9 million from central government for COVID-19 funding, the first tranche being 5.3 million and the second tranche being 5.6 million. How have we ensured equitability across the various work streams within the council? And my second question is, clearly extra funds seem insufficient given our deficit is widening, which you've just articulated. So how have we made a case for extra COVID funding to MHCLG for the third tranche in respect of recovery? And if we have made that recovery tranche application, how much have we asked for? Thank you.
Thank you, Chair. Thank you. In terms of the applications we do on a monthly basis to MHCLG, if I answer that part first, they're quite detailed. The difference between what we gave in April and what we gave in May is substantial. And that includes what we think are the costs to get back on track after the lockdown period, including all of the associated costs. And so my £20.7 million figure includes a fair portion of recovery. Obviously, that will change if things get wider. In terms of equitability of funds, that's an interesting question, and really everything is important if you look at it from different people's points of view. Obviously, we have the people who are directly affected by the illness, the COVID. However, we've also got 2 million people across the country who are unemployed. We've got almost 10 million people who are furloughed. We've got businesses that are closed at the moment. And so it's a balancing act. And what we're at the moment doing and what the government money has allowed us to ensure is that we're keeping all those plates running at the same time to ensure that everyone's being delivered to.
Thank you very much. Councillor Sanford, please.
Yeah, thank you. It sort of follows on from June's question, actually. What representations are we making on this point, through the LGA or through our members of parliament? Because I think what I'm picking up from what you said, that the government's about £11 million in additional grant, yet we're incurring costs that are something around about 21 million. So we're spending twice as much as what we're receiving. That's an unsustainable situation. And I actually saw this week in some of the local government press that there's 2 or 3 chief finance officers in the country are actually talking about issuing section 114 notices, which is effectively, closing down their authorities. So it seems to be a situation not just affecting Peterborough, councils across the country.
Peter?
Yeah, thank you, Councillor Sam. Thank you, Chair. There's a lot of representations going on at the moment. I was on a call yesterday representing Gillian with chief executives and directors of finance with the LGA, who are going in to negotiate with MHCLG or to join with MHCLG to say this is where we need money. I think central government departments, one of the things we've seen is central government departments have probably been slightly detached from delivery across the board. And the returns we've been doing to MHCLG over the last month and a half have really got them to catch up to where things are. And so really now what they're looking at as the key areas of query is, and I've talked about the 20.7 million, which is our direct revenue spending. We've also got potentially up to £26 million of non-collection of NNDR and council tax this year, which affects next year. Now that is an issue across the whole country. And so in the various groups we're in, we feed all that back in. And the government at the moment, MHCLG in particular, are trying to come up with a plan that actually ensures that all this fits. And going back to June Ball's query in terms of, is it equitable across everything, to try and make sure that it's coming out to everyone. The first set of funding we got from central government was based on care numbers. The second tranche of money we got was more weighted towards income loss. But this changes, and I'm sure when we get the further analysis from the data that came out we sent in on Friday, and every council apart from one did returns, which is almost unheard of in local government, we will get a new set of criteria in terms of what maybe future funding will come out based on.
Okay, thank you very much. Councillor Iqbal.
Thank you, Mr. Chairman. I have two questions. One is on the expenditure and one on funding. Hi, Pete. Do you think there will be more expenditure than set out in the MHCLG returns? And the second question is, do you think we will get more funding than the two tranches have already received? Thank you.
Peter.
Right, thank you, Chair. Councillor Iqbal, yes, I mean, the returns we did on Friday across the country and the meetings that are going on at the moment, all of the treasurers' societies meet with MHCLG twice a week. So that's municipal treasurers, unitary treasurers, county council treasurers, and the London boroughs and the Met boroughs. They meet twice a week. So there's lots of stuff going on. Estimates will change. It depends on how long the process is in terms of lockdown. However, when I was in a presentation with Alex Skinner, who is the Director of Finance for MHCLG on Friday, with a number of other unitary treasurers, and they're taking away these figures to look at and assess what they can negotiate with the Treasury to bring extra funding.
Okay, thank you very much. Thank you, Peter. Anybody else? No? Okay, then we'll move on from that. Peter, thank you very much. The final service area that we will look at is governance. Fiona Macmillan will speak to this item and take any questions. Fiona, would you like to provide an update to the report, or would you like to go straight to questions?
Thank you, Chairman. I'll provide a quick update first and then go to questions. Good evening, everyone. I just wanted to focus on a couple of key points from my highlight reports on how we're managing council business. The government introduced emergency legislation, the Coronavirus Act, to temporarily remove the legal requirement for local authorities to hold public meetings in person, followed by regulations which set out the detail and gave councils new powers to hold public meetings virtually by using video or telephone conferencing technology. These came into force on the 4th of April. The new regulations remove the legal requirement to hold an annual general meeting to allow councils to focus on dealing with COVID-19 and set out that appointments normally made at an annual meeting would automatically be continued until the next annual meeting after the elections next year. This includes the appointment of the mayor and all committee appointments. As per our council standing orders, the council's group leaders were consulted by the mayor before a decision was taken to cancel the AGM. The same decision has just been taken about the provisional council meeting, which had been set for the 17th of June, as group leaders agreed that there is no urgent business or time-critical motions at the moment. It's anticipated that there may be urgent business or time-critical motions that would need to go to the July meeting, and this will be discussed again at group leaders in due course. Group leaders also agreed to revisit whether we would have a mayor-making meeting later in the year if we can get back to normal meetings in the chamber. In the meantime, after testing out a number of IT platforms for virtual meetings with the equipment we currently have, we agreed to start using Zoom as it offered the best functionality. We've started holding a number of virtual meetings using the new virtual meetings protocol, which you've all had. We've had meetings of Cabinet and Planning Committee, and today we are testing having a bigger number of participants now at Scrutiny. We've also set up a new council YouTube channel, and all meetings are being live streamed on that. We've added these extra meetings of Joint Scrutiny Committee to focus on the council's response to COVID-19 to make sure information is in the public domain and allow scrutiny. This is in line with guidance issued by the Centre of Public Scrutiny on how councils should approach scrutiny during this crisis, which Gillian referred to at the start of the meeting. This guidance sets out a suggested model for effective scrutiny, which focuses on current critical business of life and limb issues for local people, the area and the council. We also sent round to all councillors the Local Government Association guidance document for councillors on the COVID-19 outbreak on the 24th of March and the supplementary guide which was issued by the LGA last week. The aim is to keep meetings as streamlined as possible, as the national guidance is that a virtual meeting shouldn't last for more than 2 hours. So we're not doing very well on that one so far tonight. You should all have received training on using Zoom by now, and your feedback on how you found the process today would be very welcome if you could send that to Democratic Services so we can continue to improve going forward. That's it for my update. Any questions, please?
Thank you, Fiona. Councillor Sanford.
Thank you, Mr. Chairman. We had a discussion on this at our Lib Dem group meeting last night, and some of my colleagues are on the call and they can chip in if they want to. But in general, members were concerned that the sort of annual council meeting. Hello?
Yeah, we're with you.
God.
You're still there.
Oh, so you can hear me? Sorry, yeah, okay. I've just got a funny thing on the screen. Yeah, some of our members were concerned that the council's annual meeting has been cancelled, and that the meeting on June the 17th has been cancelled, and there's some doubt about the July meeting. If we don't have that, we will have gone a 7-month period by October not having a full council meeting. Now, I think what I noticed from Fiona's report, because she also covers Cambridgeshire, is that in Cambridgeshire they've actually had an AGM, they've had a Communities and Partnership Committee, they've had a Constitutional Ethics Committee, Economics and Environment Committee, General Purposes Committee, Commercial and Investment Committee. So if democratic processes are good enough for Cambridgeshire, why can't we have them? Why can't we have them here in Peterborough?
Thank you very much, Fiona.
Well, the short answer to that is that Cambridgeshire is run on a different governance system from Peterborough. We have a leader and cabinet model at Peterborough, and they have a committee system at Cambridgeshire, which means that decisions can't be made if they don't run their committee meetings. Whereas here, the vast majority of decisions are made by the leader and cabinet. That's why we had to do things in a different way.
Okay, thank you. Councillor Wiggin.
Yep, thank you, Chair. I'm concerned that even though we are able to make decisions at cabinet level, we're being prevented from scrutinising those decisions if they're not directly related to COVID, as you will have seen by Councillor Harper's shutting me down on a question earlier.
No offence.
Are we going to be able to scrutinise other decisions, and where we have used the council's mechanisms, for instance, I've got calling outstanding on the growth scrutiny committee, when are things like that going to be able to take place?
Well, there weren't due to be another round of scrutiny committees for normal business until July anyway. That was in the calendar, not until July anyway. So we'll be revisiting whether those need to take place near the time. I think certainly the health one will certainly take place at the moment. In terms of anything else, we're hoping obviously to get back to normal as soon as possible, but we're focusing on dealing with COVID at the moment, and that's why the scrutiny system has been set up to allow scrutiny committees to ask all the questions that they have tonight. We are, I think, in terms of the July meeting, it's fairly likely that there will be business that needs to take place at that. So hopefully the time between council meetings won't actually be as long as Councillor Sanford's fearing.
Thank you. Councillor Over.
Thank you, Councillor Harper, Chair. Just a small logistics question. I've got a Chromebook and it neither has the ability to keep on charge. The battery runs out after about an hour. And it hasn't got the memory to deal with meetings like this. For instance, I have no pictures on here apart from yourself or whoever the speaker is. And I've got Fiona now, so I have no idea what's going on in the meeting visually. Suggestions over the last few days have been use my own computer. I haven't got one. I'm too poor. I'm an ex-teacher. I don't have a computer. And the second one was use my iPhone. Unfortunately, mine's 10 years old. And I was given it to by the council because Marco didn't want it. It hasn't got the memory and it can't deal with more than one screen. And for instance, at the moment, I'm meant to have the meeting on this screen, and I've also got the agenda and the information. So I'm a great supporter of using Zoom for meetings. I think it's great. This is the second one I've had today, but I haven't got the logistics, the equipment to deal with it.
Well, I think Councillor Over will take that up with you outside the meeting and with any other councillors that have been experiencing difficulties. I've noticed that there's been a couple on the meeting tonight that perhaps haven't got the best connection, and we'll take that up with them separately in terms of trying to improve your access to these meetings and whether or not you do need any different equipment to do that.
Thanks, Fiona. Does this mean I can go through the Curry's handbook to choose a computer?
No.
Thank you, Councillor Over. Councillor Ellis, please. Councillor Ellis.
Thank you. I think it's been very useful, this meeting. However, it's been very long, but it's because there's so many issues around COVID-19, so many different sections. And I'm really look forward to when we can please resume our scrutiny meetings, our individual scrutiny meetings, so that we can spend more time scrutinising in more depth, and also there'll be, you know, it won't be such a huge meeting like it is.
Yeah.
And also going back to the council meetings in due course soon, I hope. So please, if there is a way that we can resume to our ordinary scrutiny meetings via Zoom, which is, I think, overall.
Yes.
I mean, we have got some other meetings going on. For example, the working group on the climate change is meeting regularly via Teams at the moment. So, so please, if we can bring forward, because it has been some time now for scrutiny of not just COVID-19, but all other.
I appreciate that. Yes, we will be looking at the agendas for July and seeing what needs to go and what doesn't, and we'll take all of your comments tonight on board.
Okay, thank you very much. Thanks for all the comments. Just to assure everybody, you know, the feedback from this meeting is the first time. There was a lot on the agenda, so we will feedback our comments, and I ask you all to do the same through to Democratic Services, etc., so we can learn from this and for the next one. So thank you for your comments. Okay, there's no further questions. So Fiona, thank you very much for your input. Okay, no problem. There are no further questions. I would like to note the recommendation in the report, which is for the Joint Scrutiny Committee to note and comment on the progress made to date in responding to the impact of coronavirus. I believe we have done this. Unless there are any objections, we will accept this recommendation. I'll now just move on. I can see there's no, I've got a hand come up actually. So Councillor Sanford, please.
Yeah, I would like to make an additional recommendation because I do think
we're coming to that. We're coming to that.
Okay,
Councillor Sanford, we're coming to recommendations.
Okay.
Thank you very much. Okay. I can see no objectors to the actual recommendation, so that is approved. So we'll now move on to recommendations. Councillor Sanford, for yours, please.
Yes, I'd like to, going back to my discussion with Fiona just now, I think it's really important that we hold the July council meeting. So I would like it to be a recommendation from this committee that we do have a full council meeting in July, and that we resume the normal cycle of scrutiny committees as soon as is feasible. Because I do think, you know, at this meeting, councillors on a number of occasions have tried to raise issues that are not directly related to COVID, and we do need to get back into the normal democratic process of the council as soon as we can.
Thank you. Fiona, I think that mainly that's been put towards you. Are you happy with what, not happy, but do you understand what Councillor?
I do, and somebody said, yes, there was an agreement at group leaders on Monday that we would revisit this very soon anyway, so we'll certainly do that, yes.
Okay, well, then it was a recommendation, so I do need a seconder, please. If somebody could put their hand up to second, if they want to second it. Councillor Haynes, is that you?
That is, yes. I'd like to second that recommendation, please.
Okay, fine. Could I ask you all just to put your hands down a minute? Those have got their hands up. I will come back to you. What I want to know now is if we're all agreed to that. If anybody doesn't agree, could you put your hand up, please? Counts are over. Counts are over.
Yeah, just getting to the mute button. No, I don't agree with the first part of it. If we split it between seeking to have regular meetings as soon as possible, I'm quite happy about that. But I'm just thinking about all the people who are over 70 and may well have underlying illnesses. And I'm really not sure that come July, it will be safe for them to come out and mix with large numbers of people, even if there's a 6 foot distance between people.
Okay, thank you, Councillor.
Chairman, could I just come in? I'm not sure that that was the suggestion. I think it was that we have a virtual council meeting in July and resume normal council meetings as soon as possible after that. I think that's what the suggestion was anyway, the recommendation.
If that is the recommendation about having a virtual council meeting in July, I'm all for that.
Okay, thank you.
Could I clarify my recommendation then?
Oh, well, I think we've got it, haven't we? Do you think it needs clarifying, Fiona, or have you got it?
I'm happy for Councillor Sandford to clarify and just confirm that that's it. That's the right way of looking at it.
When I said we should have a full council meeting, I meant we should have one either virtually or possibly, as they've done in Parliament, a hybrid one where people have the option of going into the chamber or doing it from home. I think what we've seen this evening is there's a massive range of questions and points that people have, and I think we do need, you know, I think full council is effectively the parliament of the council, and I think it does need to be meeting.
Okay, thank you very much. So I've got no other hands going up to object to that, and we've got the second there. So,
Chairman,
yes.
should I just clarify again what the decision was at the last group leaders, just to put that what Councillor Sandford said in context, was that group leaders would review whether there was urgent business or whether there were any time critical motions, and then decide whether or not a July council meeting needed to be held or not. So that was what was decided on Monday, just to put what Councillor Sandford is saying in context.
Okay, good. Thank you for explaining that for everybody. I appreciate that. Good. So we've had it proposed, we've had it seconded. There seems to be no objections now, so that recommendation is accepted and passed. And I think there was another one coming through. Is it Councillor Quam? Yes, please.
Thank you very much, Chair. So how would you like me to read out my recommendation? It's the first time I'm doing so. Please do excuse me. So. Yes. I would like to make a recommendation to the Council to propose to the Department of Health and Social Care that we're able to undertake a pilot study of mass testing for COVID-19, such as those pilots rolled out in Norwich and Southampton local authorities, to keep the lower number of coronavirus diagnostic numbers that we have in the city, to prevent a second spike, and to safeguard, enable and facilitate plans in education and employment to run smoothly, and to have a positive outcome on the economy, and subsequent to that to arrange a meeting with the relevant cabinet lead and to form a working group to track on progress if this is accepted. Thank you.
Thank you. Do you have a seconder on that, please?
Yes, I do.
Councillor Yazin, is that to yourself?
Yes, happy to second, Chair.
Thank you. Dr. Robin, I guess it's to you. Do you understand the recommendation and what's required? Sorry, Councillor, Dr. Robin, I apologise, I gave another title.
Yeah, I have to say that I would need a little more background information, I think. I'm not closely acquainted with the pilots that Councillor Khayyam is talking about and the overall feasibility. So I'm absolutely in favour of continuing to reduce our number of cases and the impact of COVID-19 in Peterborough. But I don't think that I can realistically give good advice on the recommendation without going into it in a bit more depth, because it's not an area that I have looked at. So that's basically the input that I need to make at the moment. I'm turning to Fiona here. I don't know whether there's any opportunity to look at it a bit further and discuss with Councillor Khayyam in more depth, because it's not a recommendation I'm really prepared for.
Well, I think the committee members just need to hear what you've said and decide whether or not they want to accept the recommendation on that basis.
Could I just say something here, Chair?
Yes.
The justification behind it would be the fact that the authorities that have rolled it out have consistency in lower numbers that are in line with the Peterborough low numbers that we already have. So, for example, Norwich has a very good sized population, just as Peterborough does. It's got a population size of 140,000, whereas Peterborough's population is just over 200,000. They also have low rates of the virus. We've got a fantastic community spirit, and it also seeks to safeguard those at-risk populations such as care workers, BAME communities, etc. So in the long run, the feasibility of it would have a positive economic impact. And the University of East Anglia is currently undertaking, in collaboration with Norwich, this pilot study. So I guess what I'd like to reassure the committee is that if we could put the proposal to undertake this pilot study, that could then seek sources of funding to carry out this project. And I guess gaining a consensus from the committee is what I was looking for as well, so that we could then further work on it and have meetings and see if it is feasible or not.
Thank you.
Okay, further exploration, yes.
Okay, Fiona, are you happy with that? It's further exploration then, is it?
Yes,
Is that...
yeah.
Okay, right, so we've got it proposed, we've had it seconded by Councillor Yazin. I just need to check if everybody's in favour. If they're not in favour, if you could put your hands up. Councillor Casey, do you want to come in to speak, or are you just putting your hand? Oh, he's gone again.
No, I'd like to speak. I suppose my concern with this recommendation is that what I don't really want to do is set officers off on a complete sort of left turn, which then takes them away from what they should be concentrating on, which is dealing with what's happening here. And I don't know enough about, you know, I don't know enough about the background of this, but there's a danger that I think if we're saying go and do this, when actually they're thinking we haven't got enough time to do this and this is more important, then we could be setting hares running in the wrong direction.
Okay, thank you for your comments. Okay, so I take it you're against, are you, Councillor? Right, okay, anybody else want to put their hand up? No. We've got Councillor, I've got a few against by the looks of it. So, Paulina, I need to go to you for a vote, I believe.
Thank you, Chairman. I will go to the vote and read everybody's name out. We have had one or two people leave the meeting, but I will run through the whole list of people who should be voting, and obviously if we don't get an answer, that will confirm they are no longer with us. Okay, thank you. Just bear with me. Okay, so we're going to the vote on Councillor Khayyam's proposal to undertake a pilot of mass testing in Peterborough. So I will ask you, as before, I'll read your name out, and then if you can indicate if you're for, against or abstaining from the vote. So first name is Councillor Aiken.
For.
Councillor Ali.
For.
Councillor Barkham. Oh, Councillor Barkham has left the meeting. Okay. Councillor Bisby.
Abstaining.
Councillor Sandra Bond.
Abstain.
Councillor Brown.
For.
Councillor Burbidge.
For.
Councillor Casey.
Against.
Councillor Day.
For.
Councillor Dowson. I think Councillor Dowson may have left, but I'll just check. Is Councillor Dowson still here? No, I think he's gone. Councillor Ellis.
4.
Councillor John Fox.
Abstain.
Councillor Judy Fox.
Abstain.
Councillor Goodwin. Councillor Goodwin still in the meeting?
No, she left, Paulina.
Okay, thank you. Councillor Harper?
Yes, 4.
Councillor Howard?
Sorry, I'm full.
Councillor Howell?
4.
Councillor Amjad Iqbal?
4.
Councillor Jones?
4.
Councillor Lane?
Against.
Sorry, Councillor Lane, I didn't quite get that.
Yep. Against.
Against. Councillor Over?
Abstain.
Councillor Quyan?
4.
Councillor Robinson?
4.
Councillor Rush?
Abstain.
Councillor Sanford? Councillor Sanford, are you still with us?
Sorry, I'm on mute. I'm actually abstaining. So.
Okay, thank you. Councillor Simons?
Abstain.
Councillor Skibstead?
4.
Councillor Warren?
4.
Councillor Wigan?
Abstain.
Councillor Yazeen?
4.
Thank you. That's the total. So I'll just total that up.
Excuse me.
Yes.
I got missed off.
Sorry, who's that?
It's Councillor Haynes.
Oh, Councillor Haynes, I beg your pardon, Councillor Haynes. So what would you like to indicate your vote?
I'm going to have to abstain, I'm afraid. Thank you.
Abstain. Okay. Have I missed anybody else off, just to be sure?
Could you, Councillor Fitzgerald, do you need to come in now or can you wait?
I can wait for a moment, Chris.
Okay, thank you. Carry on, please, Paulina.
Thank you. So we have 16 for, 2 against, 10 abstentions. So the recommendation is carried.
Okay, thank you. As Paulina said, the recommendation is carried. I'm going to go back now quickly to Councillor Fitzgerald. You wanted to come in or something?
I did indeed, Mr. Chairman. Thank you very much. Obviously, just from an interesting point of view, because it's work that affects my portfolio and responsibility. Whilst it's laudable, Councillor Kayoum's wanting to do this, I understand why. I, like Graham Casey, have some concerns about resource and diversion of efforts from officers in terms of something that may not be possible. So I was just seeking clarification. If it's just to write and ask for consideration to be included in this or schemes similar that Councillor Kayoum has mentioned, but we know nothing about it, as Liz has said. We don't know the practicalities of it. We don't know anything. So if it is write a letter, I'm sure the officers can do that to request more details, but whether or not we could do it or seek to do it within the resources, I think it needed a longer discussion. And I'm sorry, members, those, whether you abstain, voted for and against, there really wasn't enough detail in that proposal to make a decision based on the information. That's my opinion. But I'd just like to be clear, Paulina or somebody, what this recommendation is, because it has to be enacted within my portfolio. Thank you very much.
Okay, thank you. Fiona, would you like to come in at that?
I thought Liz was saying that it would be explore doing this. Is that not what we arrived at the end?
That's what I thought. I heard Dr. Robinson.
That's what I thought we were voting on.
Sorry, Mr. Chairman. I again, forgive me. I thought Dr. Kayyum said something slightly different to start with, and then Liz said something else. So that's why I was asking for clarification what it is we're actually going to be doing, because it does come under my portfolio and it would be a resource that I would have to oversee.
Could I ask then Dr. Robin to come in and explain how she this is?
I think it would be appropriate to explore this if Councillor Kayyum is happy to accept that, because it is just something that clearly needs a more in-depth look, and I'm quite happy to talk to the Director of Public Health in Norfolk and find out what they're doing and what the benefits have been. I just think it needs a little bit of further exploration, and that should not be too resource intensive to do that.
Agree entirely.
Thank you. That's what's been voted on. So is everybody happy with that, or is anybody going to put their hand up to change? No, I've got their hands up. Could you take them down unless you want to speak? I've still got Councillor Fitzgerald. You're still on wanting to speak? Oh, he's not there. Councillor Bisby, I've got your hand up wanting to speak.
Yes, just to say that if this is just to explore it and it's not going to take too much of the officer's time and cost, then I'm happy to change my decision to agree.
Okay, Councillor, we've took the vote anyway, so you're fine. So thank you very much for making your position clear. Okay, we've got nobody else on that then, so I'm going to end at that. So we've got two recommendations and officers are clear on those, yes? Yes, good. Thank you very much. Good. Okay, I'm just going to move on to the next item. Okay, so that's all done now. So finally, before closing the meeting, I'd like to express my sincere thanks, and indeed the thanks of everyone throughout our city, to Gillian and her team and all the officers for their hard work in providing support, care, information and advice in these unprecedented times to the people of Peterborough, ourselves as elected councillors, and to all council staff. It is very much appreciated, and we recognise that these are unprecedented and difficult times, and that staff are working around the clock to ensure services are delivered in the best possible way. We thank you all very much. With no more to say, I'm going to declare the meeting closed. Thank you very much for all your input, everybody. We'll see you next time. Thank you.
Thank you.
Thank you.